Good morning, ladies and gentlemen. Thank you. Good morning. It is Monday, the 13th of February, and it is now 10 o'clock, and we are live. So, first of all, apologies for holding meetings so closely together, but this is the first chance in the last 2 or 3 years that we've had time to be able to look at the mental health strategy. So when we talk about parity of esteem, I'm not sure we or I have managed to practice what we preach. So I'm looking forward to today's session, and it is dedicated to mental health. I think we're getting really well tuned to areas like COVID and flu preparations, but maybe a bit light on the mental health side. So I would expect that we will come back to this subject area to look in more depth rather than discuss it once in 3 years and provide resounding assurance. Anyway, good morning to councillors and to our guests. Welcome. In particular, welcome to Ben Ireland, who is joining us for the first time. And there have been a variety of changes to committee, and I was hoping to welcome Councillor Mike Sutherland as well. Maybe we will see him shortly. This is the meeting of Staffordshire's Health and Care Overview and Scrutiny Committee, and I am your chair, County Councillor Jeremy Pert. I would like to make just a few introductory remarks. First of all, thank you to the Vice Chair and the Mental Health Champion for Staffordshire, County Councillor Anne Edgeler, for sharing the news of the investment in mental health services in the county through funding that is going into both the Midlands Partnership Foundation Trust and North Staffs Combined Trust. And I have arranged a briefing to better understand where the money is being targeted and what the anticipated outcomes will be in due course. Second of all, I will be signing a letter today to go to Amanda Pritchard, the Chief Executive of NHS England, regarding the use of cash resources already earmarked within our system as per our discussions on integrated care hubs a fortnight ago. In terms of those integrated care hubs feedback, due to a clash, we've not managed to look at the feedback on the questions posed last time. That was last Wednesday's meeting. I didn't have it in my diary. And we have a deadline of the end of the month. So rather than have another go at trying to get a meeting together, I'm going to suggest that the chair and the 2 vice chairs draft some thoughts and then send them around committee for your input and further comment. Are we happy with that as a proposed way forwards? Yep, a few nods, that's good. So, in terms of today's, the other comment I'd just make is in terms of COVID. I noticed there was a 60% increase in the number of cases of COVID last week. Certainly not gone away, but I would just encourage people to maintain some vigilance and encourage those people eligible for vaccinations to take them up wherever they can. So, on to today's agenda. I would like to rearrange, with your permission, please, the agenda so that we can facilitate the involvement of as many guests as possible. So, I'd like to bring forward item number 6 so that it is after the minutes and the first substantive item of the day. Are we in agreement with that, committee? Yep, that seems fine. Thank you. So, let's move on to today's agenda. Can I remind committee that we are being recorded? And for those who want to watch back today's session, the recording can be found on the County Council's website. The meeting is also being live for people to be involved and will cut off 20 seconds after the equipment has stopped. All voting committee members are in the chamber in person, and there are a variety of people attending who are our guests, who are both virtual and in presence. So thank you for those who are joining us, both virtually, but also those people who made this a special effort to get to us this morning. Can I ask our guests to note that we will have read the papers, or we have read the papers, and as a result, can I ask that people introducing the items restrict their comments to 5 or 10 minutes, depending on the item? And second of all, can we focus on the tangible outcomes for the residents of Staffordshire? Not really that interested in the process, to be honest. Actually, I'm not interested in the process I was going to say at all. Anyway, I'll leave you to decide what you're interested in, but can we just focus on the tangible outcomes rather than getting caught up in processes and procedures? Let's use the data we have in front of us and our experience to sharpen the quality of debate and scrutiny so that we can provide assurance and reassurance that with the health and care system is going in the right direction for the residents of Staffordshire. So, on to today's agenda. First of all, apologies. Zach.
Good morning, Chairman. I've received apologies from Councillor Abrahams, Jay, Sylvester Hall, Hayden and Councillor Wilcox. Councillor Norman is in attendance as a substitute for Councillor Wilcox.
Thank you for that. So, on to declarations of interest. Do we have any declarations of interest this morning? County Councillor Annett.
Yeah, good morning, everyone. Yes, declarations of interest. I'm partner governor from the County Council on the Midland Partnership Foundation Trust. Thank you.
Thank you. Any further declarations of interest? No, I will move. And just for the minutes, are we quorate this morning?
Yes, Chair.
Thank you. On to the minutes. Item number 3. First of all, to approve the minutes of Monday, the 30th of January 2023, just 2 weeks ago. Can I ask if the minutes are a true record of our last meeting for those of you who were there? We have a number of people all indicating, so thank you. And I'm reliably informed that all actions have been followed up and all information received to date has been circulated. So without further ado, I'm going to hand over to the Cabinet Member, Mark Sutton. Do you want to say a few words to introduce and then pass over to Nicola? Is that your proposed?
Yeah, I will. Thank you, Mr. Chairman, and good morning, everyone. An item here presented by the Integrated Care Board on children's mental health update, but we felt that it was important that myself and Becky Murphy, who's online, also attended so that we could either answer or take away any points that are raised that refer to the service areas that the County Council is involved in. So at that, I'm happy to hand over to Nicola to do the presentation, if it is Nicola.
Thank you, Councillor. I'll just get the presentation up to share, if that's okay. There we go.
We could see that. Thank you, Nicola.
Thank you.
Could you go full screen for us, please?
Oh, hang on a moment, sorry. This one, isn't it? Is that coming up okay?
Perfect, thank you.
Okay, so apologies because I can't actually see anybody now. And I'll try to keep this short. So I'm here as the Associate Director for Mental Health, Learning Disability and Autism and Children and Young People for the ICB, but I'm joined by colleagues, as Councillor says, Becky Murphy from Staffordshire County Council, Lisa Edwards and Saab O'Brien from MPFT, and also Deb Hargreaves from North Staffs Combined Healthcare. So hopefully we'll be able to answer your questions as we go through. So I'll try to keep this as short as we can, but give you the detail that you need. So we're going to really go over the sort of mental health portfolio overview, what are the specific children's mental health priorities, and also the challenges and opportunities that we have in place, and we'll need support from yourselves as a cabinet. So it's really just to say, obviously, that the long-term plan does set out a whole range of priorities and key deliverables for mental health that cover their entire lifespan, but obviously we're focusing here specifically on children and young people. So these are there's a whole range of programmes that require really prioritisation across all organisations, hence the sort of multi-agency approach that we've taken here today. So in reference to your sort of point around COVID earlier, this has absolutely led to an increased demand in mental health services, and obviously the cost of living crisis is beginning to impact. And we're seeing some evidence already of those sort of increases in referrals. But the LTP, the long-term plan for mental health, which sets out this sort of NHS's direction, does remain a really solid foundation to deliver mental health services in the context of today. So there has been an inevitable impact on the expansion and transformation of mental health services from the pandemic, but we continue to invest, expand and fast track the transformation of children's mental health services so that people can access the care that they need. So this is really a structure slide. So taking you to your point about process, this has actually moved on even from this point. So we now have needs to go through governance, but a mental health learning disability programme board, where there'll be a delivery group that sits under that. But there is a very clear CYP system improvement board that Josie Gately chairs, that has our real focus on children's, because we're conscious that sometimes children's can get lost, or the perception is it can get lost in the vastness of what is adult care sometimes. And importantly, it's also useful to note that there's a separate CYP board as well, where the sort of physical health aspects are delivered, and we have links across to that as well. Oh, I think I've just skipped one. Again, these are just a range of indicators that are mandated across the programme, and we have to meet these to demonstrate that we're spending our investment as we should do. So there's some specifics that are ring-fenced to children and young people here that we need to make sure that we deliver on. To that end, as part of the sort of new portfolio structure that we've established, we have now a system dashboard. And as you can see, this covers sort of all age really at the moment, and this is scrutinised by the Mental Health Programme Board as well as the ICB structures. And this is really in terms of making sure that we're sighted on where our performance is and where we need to change. Oh, have I skipped one again? Beg your pardon. This is sort of a snapshot specifically of the CAMS data. And this is very much the sort of latest cut. So we have, unfortunately, quite a big time lag in terms of the data that's produced under the mental health minimum data set. It's about 3 months, and unfortunately it was suspended during December, so this data is a little old, but this is the kind of scrutiny that we look to in terms of making sure that we're on track in terms of our current position, making sure that we're sighted on the issues, and then how we're moving to address those areas that require action. So if I move over to the children's priorities then, so I'm just going to take you through this. It's a really detailed programme, so we can't sort of spend loads of times on each of these elements, but it's really just to, you know, as obviously Cabinet members will be more than aware that, you know, children and young people represent a third of our country, and there's been lots of improvements over the years which have been singled out for action, and we really need to build on that and broaden our focus. You know, there's lots of work going on, but if we don't focus on children and young people, we're really not tackling the inequalities. And the NHS and the LTP, along with our partners, play a real crucial role in improving the health of children and young people. But we all know that the health of children and young people is determined by far more than just healthcare itself. It's household income, it's education, it's housing, it's family life, it's a healthy environment. These all significantly influence young people's health and life chances. So it's why it's so important that we really work with our local government and other public services, because they play an absolutely crucial role in terms of improving mental health. So this is really our children's and young people's strategy around wellbeing and our local transformation plan. So we have an existing strategy that ends this year, and an LTP, a local transformation plan, that's refreshed every year. And the LTP is mandated by NHSE against a really extensive set of CLOEs that we have to meet. We also, as referenced earlier, have this dedicated CYP mental health system improvement board, and it's got a range of task and delivery groups under that are focused on those areas that you can see there, that are really kind of working towards making that that sort of system change, really, in terms of quality improvement, that population health approach. What our intention is moving forward is that we'll use the local transformation plan to be our strategy and plan as well, and obviously link to the Staffordshire mental health strategy that Jan's here to talk about a bit later. Again, this is really just talking about some of our provision that we have in place. So we have what's called children and young people's access rates, and we achieve those really highly across Staffordshire, and that's partly due to the joint commissioning that we do with the local authority around services like Action for Children. We have children and young people's dedicated eating disorder services that we've experienced really high increases in demand and complexity at the moment, but we continue to work with that. We have 24/7 crisis provision commissioned for children and young people. There are inherent challenges with that in terms of workforce and recruitment, which we'll come on to later. We have what's called Core 24, which is all age liaison psychiatry. So that's based at both Royal Stoke and the Queen's Hospital in Burton. And we also have provision at County Hospital in Stafford. And we've been very successful as the Trailblazers, which we'll come on to talk about in a bit more detail later. So I think at this point, I hand over to Lise. Is that okay, Lise?
Fine, thank you, Nikki. So this diagram is just seeking to outline the way in which how we think about and organise children's mental health services is changing. So on the left-hand side, there's a tiered model which you might be familiar with. It's language that we still use and in the system, which represents sort of levels of need going up in a linear way. But that's being replaced by what's called the Thrive model, which is the diagram on the right-hand side, and that's seeking to emphasise that what we need to be doing is keeping most children well in the centre of that model, that they're thriving in the centre of that model, and making sure that we're meeting needs to be preventative, really, around emotional health and well-being. And Saab, when she talks to you about the mental health support teams for schools, we'll be talking about a whole school approach, and that's one way in which we do that. And then through the quadrants of Thrive, it recognises that people can access mental health services at any level, depending on their needs, but can work in a much more fluid way. So there might be people that just need some advice and support in the green quadrant. That could be from a third sector organisation, it could be from their school, it could be from a health professional. People that need a bit more input, maybe sort of 6 to 8 weeks, have maybe one need that could be a goal-based support around meeting a particular need. And certainly that's some of the work that partners such as Action for Children do. Getting more help is probably where the more specialised CAMS services come in, might have more extensive needs, more specialised needs, might need a longer intervention, or a different input of different professionals. And the quadrant that's called Getting Risk Support is a real multi-agency area, and this is for young people that probably can't benefit at the moment from that therapeutic need, but just need to be supported to be kept safe until such time that they can engage with a more therapeutic offer. And that's an area of real multi-agency work with a whole range of partners. So that's just to outline the language that we're now using to talk about children's mental health and the frameworks we're using. Nikki, if you want to go to the next slide. What this diagram attempts to do is to look at how our local services map to that Thrive model. The yellow sort of halos around some of those circles indicate where we've utilised some of the investment that Nikki's talked about through the mental health improvement standards that's come as part of that long-term plan. So in the getting advice quadrant, both ourselves and North staffs combined have a single point of access. We're working in partnership, or both are working in partnership with Action for Children as the local support, getting help type provider, and we're increasingly trying to make sure that it doesn't matter that that parents, carers, professionals don't need to worry about what kind of support they need, that they can ring those single points of access with a need, and we can help identify the right service for that person and pull the right service to that young person. And certainly through the recent investment, we have invested quite heavily in our front door, and we're also in new premises and going live with a new offer the end of this month. Moving on to getting help, this is where the mental health support teams for schools that Saab will give you more detail about have been an increasing feature on the landscape and rolling out in every district, which we a real benefit, I think, for local children. Obviously, we have Action for Children that's commissioned by partnership with the local authority and MPFT. There's organisations such as Malachi and Family Action that provide family support. That might be in that getting help quadrant, and we have an autism service both north and south now that also provides some of that getting help brief intervention. Moving up into more complex needs, this is the sort of the territory of NHS organisations more traditionally, and again, as Nikki's alluded to, the long-term plan has seen investment in eating disorders, and we've used some of the mental health investment services to expand our core CAMS offer, which are our district-based community teams. We also have some more specialist teams around young certainly in the south of the county early years, so 0 to 5, and we've had quite a significant additional investment in autism services north and south, recognising the needs of autistic young people. And then I mentioned the getting risk support quadrant, which is a real the multi-agency element, and from an NHS perspective we've had significant investment to attempt to mobilise a home treatment type service and an intensive support service that could support young people in crisis. Our challenge to that has been identifying the workforce and recruiting to that workforce. So we haven't got the certainly the hours of operation that we aspire to deliver, and we're building that as we can, and also looking at how we build and grow our own workforce, because it's absolutely clear that they aren't out there in abundance. So I think that was the main things I wanted to raise on that slide, Nikki.
Elise, if I hand over to Saab.
Sorry, can I just interrupt? We've got this as an agenda item later on in the agenda, and unless there's a real requirement to cover it now, given that we're already 20 minutes in, can we just try and wind up the presentation and come back to this slide as part of the agenda item later on, please?
Yes, of course, Chair. Deb?
Okay, so just very, very briefly, given time limits, it was just to sort of introduce Combined Wellbeing, which is our digital offer from North Staff's Combined Healthcare. It came into creation as part of the digital exemplar in 2017 and obviously expanded, especially given COVID was a massive driver in order for us to meet and communicate with young people across North Staffordshire. It's not exclusively for children from North Staffordshire, but the referral system is uniquely for them. So the website allows signposting, it provides information for carers, professionals and young people. There's an ability to self-refer online. We now have 100% accuracy with the referrals going to the correct teams through optimization of our Lorenzo system, which is our EPR. It also provides some treatment in order that young people can access apps through the website and are given sort of passcodes to be able to access those apps that are suitable for the conditions that they're providing treatment for. And then finally, there's lots of self-management information for those people who maybe are at a very lower level getting advice stage of the Thrive model, where they can access some self-management, some self-help and some information. The new exciting part of the digital offer is that it's going to link in with our Patient Aid app, which is part of Lorenzo, which means that young people can go in, access notes, access their care plans, do outcome measures, and be very much involved in their care from a very digital viewpoint, which obviously is one of the best ways we're finding of communicating with our young people across the region. Okay.
Thank you, Deb. Back to you, yourself, Lisa and Saab.
Saab, are you going to take some of the highlights around the digital?
Yeah, so we've invested quite a lot of time into our CAMS website. So as Deb's just mentioned, North Staffs have got a number of self-help tools, and we've created one for the south of Staffordshire as well. And we've also created a self-referral tool as well. So over the past year, we've had self-referral launched in the South County, and we've had a very good uptake on that self-referral option.
And I guess just to follow on from that, in terms of how we're working within the organisation, we're working in a much more multi-agency way to reduce. One of the things we heard loud and clear was people feeling like being passed from different services. So introduce different ways of meeting to try and prevent that. Particular focus on reducing backlog of assessment for autism assessment. I've talked about our single point of access, and I think I've already touched on our challenges recruiting, particularly to intensive support. So there's probably nothing additional to add to that slide.
Thank you. And again, this is just a summary of key challenges and opportunities. I think we've covered most of this in the content. We do have some specific challenges around neurodevelopmental provision. So whilst we've got a clear offer around autism, it's also ADHD and those interactions with mental health and autism. And I guess the challenge that we're putting to ourselves is, are we commissioning services that meet children and young people's needs in the best ways? Is there an opportunity to review priorities to ensure greater alignment, with the local authority and partners as well? So I'll just end there, if that's okay. Chair.
Thank you, that's most helpful. The person who was going to ask the first question is no longer with us. And Mark, would you like to come in?
Obviously a matter for you, completely for yourself, Mr. Chairman. I just wondered whether it would add some value if Becky Murphy was able to say a few words about how what we've already heard relates to what in the County Council we're doing as well. I think it might add a bit of value.
It would absolutely add value. And Nikki, let us bring you in if I can, please. And maybe you could restrict your comments to maybe maximum 5 minutes, please.
Yeah, hi, so I'm Becky Murphy. I'm a commissioning officer working within children's public health, and the area of work that I support on is around children's mental health. So as Mark said, there are a number of things we're doing as a local authority to kind of support this agenda. One of the major things that I'm involved with is the support that we provide to schools. So we do have in every school, there's the recommendation from central government that they do identify a senior mental health lead in schools who are responsible for that strategic approach. We've mentioned the whole school approach briefly, and I know we'll look at that in a little bit more detail, the mental health support teams item. What we're really conscious of, though, is when you're identified as a lead within a school, that can be quite an isolated position. You might be the only lead within the school for mental health. So actually what we've done as a local authority is we've set up a network for senior mental health leads, not just in schools, but in across education settings, so post-16 education settings and alternative provision, as well as schools. And that's essentially a network that we bring together on a termly basis, although we do encourage conversation. We've set up an online platform to allow us to have those continual conversations. And essentially it's a place where we can share resources, ideas, information, and essentially support those leads in schools to deliver on that agenda. We're also doing some work at the moment, working with colleagues who've been appointed as PSHE PSHE coordinators. One of the things they're looking at is what information and resources we can provide again to those colleagues in schools who are responsible for delivering the mental health curriculum. And we're working with colleagues and in partners at the moment to develop a mental health resource pack. We're also really keen for our work to be informed by what schools and other colleagues are telling us. So we recently did a survey in autumn of last year, where we wrote out to all schools and asked them for their views on mental health and wellbeing, both from the point of view of students and pupils, but also staff wellbeing. We had a really excellent response to that survey, so we had over 350 responses come through, and what we're now doing now is having a look at those and responding to the recommendations and findings. We'll be putting together an action plan, so where schools have told us they need support, assistance, resources, information, we'll be working with partners to actually produce that information for the schools. Nikki also mentioned the partnership work that's going on, so the local authority is absolutely fully represented on the ICS Mental Health Children and Young People's Board. So there are a number of work streams that sit underneath that, where we're looking at particular elements of the mental health system, so care experience, children and young people, capacity and demand, workforce development. The local authority are represented on all of those groups, and we are contributing to the delivery of actions under that. As Nikki said, we also are jointly commissioning the Action for Children service. I know that you're really keen on hearing about outcomes rather than just processes, and the Action for Children services has been commissioned based on outcomes. So through the contract management of that contract, we do measure the outcomes achieved. So as part of that intervention, children and young people are supported to identify goal-based outcomes, what they're looking to achieve from the intervention, whether that be digital, whether it be face-to-face interventions, and that's actually monitored throughout the course of the intervention. The results that we're finding on that is really positive. So, for example, just over the first couple of years of the contract, where children and young people are receiving face-to-face direct support, they're reporting 99% achievement of those outcomes. Where they're receiving digital support, it's slightly lower at 86%. And where vulnerable young people are accessing sort of the risk management elements of those services, we've got 100% achievement across year 1 and year 2 of those outcomes. So those are outcomes that young people have identified for themselves and then are reporting achievement of throughout the life course of that intervention. I don't want to say too much more because I'm conscious I don't want to use up time, but more than happy to take questions around any of the work that the local authority are doing and contributing to the partnership approach around mental health.
Thank you, that's most helpful. Nicola, maybe you can help navigate us through with a number of people online in terms of where the right questions should go to when we get there. Can I bring in Charlotte Atkins, please?
Thank you. I just, excuse me, I just noticed on the page looking at mental health CAMS about the different performance between the combined healthcare and the Midlands Partnership, particularly on young people's eating disorders. There's a significant difference of performance, and I wondered whether that difference in performance was reflected in access to other mental health services, and if so, or even if not, what's the reason for the better performance by North Staffordshire Combined Healthcare as compared to the others? What are they doing which the others are not managing to do? And what conclusions have you drawn from that?
You're on page 83, aren't you? So, Nicola, with you.
Yep, so thank you for that question. The numbers in terms of some of those that drive some of those figures are incredibly small. So we're talking about 2 or 3 children or young people. So when one child breaches, then that looks like it's a really poor performance, but it isn't. And obviously, you know, that's absolutely not where we want to be in terms of breaching any of those standards. As I say, the data cut for this was some time ago, and that's because of the data lag. But what we do is work with our providers during that time to actually look at areas where we can redress that performance. And I think it's fair to say, at least, that position has recovered now in terms of delivery. Some of it alludes to the workforce issues that we've spoken about. So we've got a particular challenge with dietetics, recruitment of dietetics and medical provision. But all of those children are supported effectively. And obviously we're working towards redressing that performance, and I believe it is where it needs to be as of today, but obviously we need to present that data back to you to give you that assurance. But it has been a particular challenge around the recruitment of dietetics and medic support that has been one of the issues that's driven that. Lisa, I don't know if there's anything more you want to add to that discussion.
I mean, I would echo what you've said. They are often small numbers that make numerically a big difference. So in December, which is the last data I had, there was one young person, and that wasn't assessed within the timescale, and that was because they were due to have a joint assessment with CAMS. So what that means is that the young person is already open to core CAMS and receiving that support, and it's kind of a step up into support with eating disorders. So to try and get the professionals together in a room to have that joint assessment, and we have talked about, well, should we just go ahead with the eating disorders assessment, but actually holding the young person at the centre of it, what that would mean is the family then telling their story twice to another service. So we'd rather wait, an extra 2 or 3 days to have that joint appointment, so that feels joined up for the family, than sort of a bit at risk of hitting the target and missing the point. So I think we do need to look at the statistics in the round in terms of they're often very small numbers, but I think it's a really good point about what are we learning from each other. And I think the ICS board is a place where we do come together as providers and with local authority colleagues, and it provides us that forum to do that. I think perhaps we haven't got a subgroup around children's eating disorders, but I think perhaps that might be somewhere where we should look at, actually what is the learning? Are people doing things differently and better? Because I think that ICS group is the vehicle by which we're doing that quite successfully in a lot of cases. So I think we need to continue to do that and reflect about whether there's further opportunity around learning and sharing best practice.
Charlotte.
Thank you for that. The second question I want to ask is about the backlog for assessment for young people, for their young people's autism services, and whether, when you're working in partnership, you're working with the Caldwell Autism Centre?
Yes, thank you. I mean, both Lisa and Deb can pick this up as well, but yes, we've obviously realised we've had waiting list issues and have deployed a number of options to reduce that sort of waiting times, and Caldwell has been one of those agencies that we've worked with. I mean, they've got a fantastic centre up at Keele. Lisa, Deb, if I bring you in on some of the detail.
Yeah, so we have a subcontract arrangement with Caldwell Children's at the minute for support with assessment capacity. We've worked off we've started most of our assessments within the sort of 12 to 14 week period since a big sort of push last summer. Or was it the summer before now, Nikki? However, we've still got a number of children that are mid-assessment, too many really, that we want to try and create some capacity so that we can complete what we've started. So we use Caldwell and some other providers quite successfully, have good relationships and effective pathways between them, and they're doing as many assessments as they're able to for us at the minute per month. I don't know, Deb, if you want to add from a combined healthcare perspective.
Yeah, from combined, similar issues as we've had in others in MPFT with regards to wait lists and sort of capacity very much outstripping demand. So we also commissioned Caldwell to provide some assessments for us just to reduce that wait time and to support those young people who were waiting. We've also received investment. We're currently recruiting to expand our children's autism service from 0 to 25, which then creates more capacity in the system, as that will create an overlap with our adult service. That then means that we will be able to reduce our waiting lists further and provide post-diagnostic support.
Thank you. Just picking up Charlotte's point on data, particularly on page 82 and 83, it's really difficult to understand what the trend is and where the action plans are with it. I know I might be a bit of a data nerd, but it's just very difficult to pick out whether it's great performance, good performance, or whether it's poor and getting worse. And it's just really quite difficult. And a bit of narrative to tell us what we should have read into the slides would have been quite helpful on particularly on the block of the dashboard, maybe. Just to that point, though, I'm assuming you're going to, going forward, share the dashboard with us on a quarterly basis so that we get a view of performance data alongside the ICB's performance data. And second of all, I'm assuming it is integrated across both children's, i.e. the social services side, social care side of things, as well as the NHS side of things.
So in terms of the data dashboard, then that will be shared. Obviously, it's an all-age dashboard. It does include social care indicators that are nationally set, but I'd need to go and check the specific children and young people's ones to ensure that they're reflected. But it does include the suicide statistics, etc., and things like that. So it is trying to give that broad view, but it's very much using the national data sets that are available to us to pull that down. But I will seek clarity to ensure that the children and young people's ones are on there, Chair.
Okay, thank you. Can I bring in Keith Funder, please?
Thank you, Chair. I think as just a quick comment on what you just said, I think it's going to take probably a bit of time for us to get used to the dashboards, trends and data that we're now using and seeing. So I think that's something that we'll probably have to spend a bit of time on, and hopefully over the next year we'll get more used to it. Also, there is a bit of an overlap, as we know, with all three of the items today. So it's going to be tricky necessarily to keep things. So I'm trying to do a slightly wider picture at the moment. Obviously, within children's services, at the moment, we want early intervention. That's something that's been being formulated and being worked on a continuous basis for some time now. And through my involvement with the Family Improvement Board and other areas as well, and school visits, how does this fit into the rest of what we're trying to do within the county in relation to family hubs, family improvement and how that works, and how that might then, any funding that's coming in could then support our own objectives along with the NHS and all the people that have been mentioned in these slides. How do we integrate that on a more firmer basis than we are at the moment, which will then support children's services and mental health services throughout the whole county? Thank you.
That sounds like a Becky Murphy question.
Yes, I was just raising my hand there just to say I'm happy to take that. So absolutely, from a local authority point of view, one of the main vehicles by which we deliver early help and early intervention is through the Building Resilient Families and Communities programme, which is, as you'll know, our local approach to the National Supporting Families programme. You'll probably be aware that in the set of new outcomes or revised outcomes that they have produced for that programme, mental health is actually a key feature of that. So we are working really closely with the Building Resilient Families and Communities team to make sure that the work we're doing on developing outcomes, measures, data dashboards, etc. around mental health absolutely align with the way that we are collecting and looking at and scrutinising the way that we deliver early help in the county as well. One of the work streams specifically that Nikki mentioned on one of the slides, so there was a list of priorities with access, demand, looked after children, etc. One of those is looking specifically at prevention and early intervention, so that we're really conscious that actually, although it's really important that we get things right at the real high end of the scale in terms of really vulnerable children and risk management, actually it's just as important that we work upstream and try and prevent people from getting to that point where they do need those higher intervention services. So the work we do with Action for Children is very much at that lower end, the mild to moderate mental health and emotional well-being. You'll also have seen on the slide reference to Malachi Family Support, and I know Lisa also mentioned Family Action, who's our other provider. They are our early help providers in the county, and again, one of the criteria that they would consider for families and children accessing that service would be mental health and emotional well-being. So we are really keen to do exactly that the elected member described, which is actually join up those agendas. So when we're talking about mental health, we're absolutely cognizant of the fact that that needs to be an early help and preventative approach, as well as focusing on that more high-end level. So, and the way we're trying to do that in Staffordshire is to make sure that we're actually joining that up and being a sort of integral part of the Building Resilient Families and Communities programme.
Brilliant. Can I bring in Mark Sutton, please?
So, Mr. Chairman, on that point, two particular points I'd like to make. One, Part of the Staffordshire Joint Health and Wellbeing Strategy is good mental health, and good mental health, across the board, not just for adults. And how we're developing the Health and Wellbeing Board is each one of the 4 priorities, of which mental health is one. There will be a lead from both the County Council and also from the Integrated Care Board. So that will help that joined up working. And then secondly, as we develop family hubs going forward and decide on the model, I'm very keen that children's good mental health is part of how we look at that as that development goes on.
Thank you. Keith.
That's good news, and I think that's something that we could hopefully then improve on the number of people being, going through the CAM system as well. Then hopefully we can concentrate on that a bit more once we've got this joined-up thinking going on. And I think that would help tremendously in terms of the schools and everything else, which is something I'll come on to because it's another agenda item, but I've got some concerns on that as well. Just one slight thing. Are we really saying that 35% of all children need to have access to services at the moment? Or is that just something, that to me that seems extremely high, but that could just be me? I don't know. That's just a general question. Thank you.
So I think you were referring to the 35% access rate there. So that's essentially 35% of the what's called the prevalent population that they expect children and young people to have a mental health issue. So it's not 35% of the entire children and young people's population. It's 35% of the prevalent population that children and young people have mental ill health. But again, it's not necessarily that all of those children require treatment or long-term therapeutic interventions. It can be 1 or 2, contact interventions that actually give that child and young person the support that the family needs to be able to implement strategies to improve their mental well-being, so they don't actually formally need to come into sort of CAMS specialist services, if you like. So hopefully that clarifies that for you, Councillor.
Keith, if you're going to ask a follow-up, very brief, please.
Yeah, well, does that mean 65% of children that need something aren't being seen then? I don't. It doesn't seem to make sense. And again, that's just, it's probably my interpretation that's not correct.
I think my read of the number was, based on what Nicola's just said, is that it's 35% need further follow-up work of the prevalent people who have a mental health issue. I think that's the, is that interpretation correct, Nicola?
It is, but I think it's that's the sort of national standard that we're asked to meet, if that makes sense. So it is recognising that there will be, they will be the children and young people that have a sort of diagnosable mental health condition, but there obviously be a range of children and young people that will have low-level mental health needs that might still require support. But that's our sort of national standard that we're currently asked to meet. We actually exceed it in Staffordshire quite significantly. I think we're more around the sort of 45% mark, but there still is a gap, and that's the truth.
Yeah, thank you. I think it does require some further digging outside of this session, but let me move on to Angela, please.
Thank you very much, Chairman, and thank you all for your presentation. All right, we all know we've got a problem with CAMS and the workforce and that, so I hope that's a big ongoing problem that we're trying to address, which I'm reading the papers, I believe that is true. My question really is to Becky, I do believe. Bearing in mind we've got 400 plus schools in the Staffordshire County, are they all on board working with mental health? Are they all on board helping these children and what have you? That's my first question. And my second question is, if I refer to page 9, at the bottom of page 9, wider commitments, additional investment in youth justice services, what does that mean and what are you doing about it, please? Thank you.
Just for reference, page 85 of members' packs. Becky.
Yeah, of course. I'm happy to take the first part of that question. I might need to defer to Councillor Sutton with regard to the second element. But certainly, yeah, in terms of the first element, we have got over 400 schools. And I mentioned that the survey we'd done last autumn, we had 350 responses, which is not a bad proportion, but it's certainly not 100% by any means. So one of the questions we asked in that survey was around how schools are getting on with implementing the whole school approach to mental health. So we had just under 50% who responded to say that either they felt that they'd fully implemented it or they were on the journey to implementing the whole school approach to mental health. You'll notice that that does leave another 50% where they weren't sure what they were doing or they hadn't actually made a start on that journey. And that's something that we're really aware of and that we're trying to work on as a local authority. So we are regularly reaching out to schools, both through the Senior Mental Health Leads in Education network to encourage them to do that, but also through other forums. So, for example, during a little bit later on during this term, we are going to be going to the designated safeguarding leads forums that take place around the county as well. So all schools have a designated safeguarding lead. We are going to be talking to them about the importance of mental health, about identifying a senior mental health lead, and about talking to them about the resources and support that is available to them. So I think it would be true to say, Councillor, that we are on the journey, but I don't think it would be true to say we've arrived at the destination yet. I think there is still more work to be done to get all schools on board with regard to delivering the whole school approach to mental health. So we're partway there, but we're not completely there. In terms of the youth justice, I'm afraid that's not an area that I'm directly involved with. So I don't know, Councillor Sutton, whether that's something that you are able to assist with.
And do you want to just
catch that bit?
Reflect the question in terms of youth justice, please?
Yes, I mean, I'm just looking at what it said about the investment in youth justice services on mental health, and I'm just wondering what's on board and what is being done.
So I don't know if it's my hearing this morning, but it's just so muffled over here in the chamber for me.
So the question here is on page 85 of the pack, the bottom block, the bottom right block, where it says wider commitments. It talks about additional investment in youth justice services. And the question was, do you know what that is? Happy to take that outside of the meeting. If you'd like, we could do a written response through we can do a written response if you prefer. Alternatively, Nicola Bromwich is waving vigorously and she may have some answers.
I was going to say, I absolutely have no knowledge of any investment from youth justice perspective, but happy to find out.
That's fine, thank you. Nicola, do you want to take the same view and we'll do it by written response?
The youth justice element is referencing a very specific services. So these are, for the NHS perspective, funded by NHSE. So we have what's known as all age liaison and diversion services. So these are services that seek to, where there may be some criminal activity or some concerns, seek to divert that individual out of the criminal justice system, pertaining to their mental health need. Other elements that we're working around the youth justice is that we've secured some investment to look at how we co-produce services with those children and young people. And again, we're working in partnership with the local authority on that in terms of that sort of co-production offer as to what that might look like. So just to put a little bit of information around that item.
Thank you, that's helpful. And, you know, we should also mention some of the work being done by the Police, Fire and Crime Commissioner with things like space, if we talk about diversion, and also the districts and boroughs quite regularly are doing additional stuff as part of their community safety partnership plans. And Angela?
No, I've no further comments, Chair. Thank you.
Thank you. We'll come back to you later for your last question. Richard, please.
Thank you, Chairman. With regards to the mental health support teams in schools, I'm particularly concerned, and I want assurances that whilst the papers in front of us do not make any reference to diabetes, that diabetes is something that is on the radar here, because you have to associate depression and early signs of mental health with diabetes. And the reason I raised this question, the Lichfield District actually launched their first, a few weeks ago, a youth council. And in the open discussion of what we'd like on the agenda, diabetes was referenced to mental health. Now, this is from the school children. So I think if we are setting these things up to listen to what they have to say, it's only then right and proper that you bring it to the forum. And I was just wanting to make sure that diabetes is a subject matter that is looked at as well within in terms of leading to mental health issues. And can I just seek assurances that I've noticed the bullet points on that page 90, page 92, the youth MHA's participation forum, which was Burton and New Toxeter. I see the April 2021 date, and then I also saw just slightly to the right the school supporting offering 2020-21. Are these activities still current, and is there similar throughout other districts within our within Staffordshire? Thank you.
Thanks, Nicola. We're with you, I think.
Yes, I think it's a really important point around physical health and mental health, isn't it, for children and young people, and how we provide that integrated approach. So, you know, and we've got actually an asthma in schools pilot to start as well fairly soon, just picking up on that. But it is about seeing children as a whole person, isn't it, and how they're not a single issue or they're not a single diagnosis, and you're absolutely right on that. If I bring in Saab in terms of some of the detail, is that okay, Saab?
Yes, of course. So yeah, just to echo what Nikki just said about physical health, we are exploring lots of physical health activity services to come in. So due to workforce challenges, we have got an underspend, which we have spent a bit of time thinking about some of that physical approach of need in schools as well. So we're definitely picking up on that. And just picking up on the participation query. So participation, again, was something that we were very much driving, and it was working really effectively across all of South Staffordshire localities. So that would have been children, young people representing across all of our localities. However, due to workforce issues, again, our participation worker did leave, and we have had a little bit of a lull in the delivery of participation. However, we have been successful in reinstigating participation within the South again. So we are in the process of recruiting participation workers and having sort of a young advisors approach to participation delivery across the South.
And just to pick up on your points about the dates, the curriculum dates, that those activities are still ongoing in those areas with mental health support teams. It's just that was a picture from a sort of older curriculum, if you like. Deb, I don't know if there's anything you want to add for North Staffordshire, because I know there's participation that happens in North Staffordshire as well.
Yeah, so we've just successfully recruited a whole school approach lead within our MHSTs that's looking about participation across all the schools that are involved in MHST, and that sort of can't call it trailblazer anymore, it's run-of-the-mill practice now. But yes, that's really quite exciting, and creating school ambassadors who are there to support and gain information, feedback from those people who have used services, whether that be mental health support teams or the sort of core CAMS element, to look at how we improve and evolve our services to meet the needs of young people.
Richard.
No, I think I've heard correctly. The sound isn't very good this morning, I'll be honest, but I think I've grasped what was being responded. Obviously, it's key to my mind in terms of the diabetes. It's simple that depression does come through, follows on from diabetes diagnosis, which whether it's type 1 or 2. And for an adult, it takes a lot to get to terms with. And I would think for a child, it's going to be even more. So I'm really impressed that it is something that is not forgotten about. Thank you, Chairman.
I think that Richard touched on a really important point, because I think what we've not seen in this pack is which bits of Staffordshire are getting which services. Because actually, I'm a bit concerned that there's stuff going on, you know, between North Staffs combined, and that's fine. But actually, we as a health committee across the county want to see access to the same services across the county, surely. And I haven't seen that. And I think that Richard makes a really good point. And I think, you know, rather than discussing this, because the sound this morning is not very good, I'm struggling to hear much of what's going on. And I know a number of other members are, but maybe you could come back to us in writing with core services and where they're available, and the non-core additional services that you're developing. Because, you know, I don't think we should expect, you know, every service to be available everywhere, because it's work in progress. Maybe you could do that for me. And let me just move on to Steve, please, if I can.
Thank you, Chair. I think it's relevant to this agenda item rather than 5, regarding part 3, the key challenges and opportunities, and it says referrals consistently increasing in number and complexity. I'm chair of Chasetown Community School, and we're having more complex children with more complex needs for our children, and we're also oversubscribed. So my question is, regarding the key challenges and opportunities, do we have the capacity? Is the capacity being expanded? Because we're oversubscribed in our school, special school, and I just wonder what the situation was. Thank you, Chair. Thank you.
Useful question. Who's going to pick that up? Nicola?
I think that there is absolutely recognition that COVID has hugely impacted, I think, children's services. I think some of the developmental milestones that children would normally have made haven't happened during COVID, and we are dealing with a sort of exceptional situation. So the demand is there, and I think it's being seen across the board. It's not just in MPFT and combined, as you quite rightly say. From a mental health perspective, obviously we have the mental health investment standard, and we're able to make those investments around children's mental health. And I think it alludes to one of the councillor's points earlier when he spoke about the links with family hubs. I think it's how we use that investment to make those wider links across wider initiatives that actually give that sort of benefit at a much earlier level, and hopefully will kind of reduce that demand moving forward. Again, the mental health support teams in schools, that's the whole premise of that initiative, to reduce that sort of demand moving forward. But I think it's absolutely recognising where you are in terms of that school setting, in terms of that position. At least I don't know if there's anything you want to add in particular around sort of Cannock Chase area or Saab.
In terms of MHSTs, Nikki, in Cannock Chase?
I think in just terms of how we're managing demand, I think, and acuity.
I mean, I can give some global figures around demand into our services, and if I compare in the last year to date compared to the same period in 1920, referrals are about 18.4% higher. Now, it is true to say that we have some additional services that we didn't have in 1920, so the MHSTs in particular. So what that's doing is, I guess, identifying need or bringing more children into contact with services that wouldn't otherwise have done so. But I think, you know, certainly in practice, our clinicians report that they are seeing an increase in complexity and increase in levels of need, and I think that's pervasive across a number of settings. I think schools report the same. I think COVID has been a bit of a perfect storm. There was an underlying increase in children's mental health need, but I think COVID has certainly exacerbated that. I don't think there's anything necessarily all localities will have some of their own sort of personality and their own sorts of issues. I'm not aware of anything particular that I could mention today in relation to Cannock. Saab, I don't know if you can, in terms of the MHSTs that we've now got there and the sorts of needs they're seeing.
Yeah, so Cannock's always been one of our highest sort of access areas or localities, and we allocated a mental health support team there in the second wave, and we've seen increase in numbers. And I think that's part of the promotion and prevention work that we do as part of the whole school approach work. We're informing children and young people more about their emotional health and well-being, and, you know, needing to come out and break some of that stigma down and ask for support. So we have seen an increase in referrals. We work really closely with the 5 schools within Cannock and Rugeley, 5 secondary schools that we do cover. But as we said, our Cannock teams, CAMS teams, do have some complexities with recruitment at the moment. So I do think that there is a challenge in terms of getting that access rate higher and getting the young people seen as soon as we'd probably like. But I do feel that mental health support teams and working in partnership with services like Action for Children and also implementing a digital offer across our localities has sort of supported with us being able to support those children and young people presenting with that higher acuity sooner, because some of that lower level support is being offered elsewhere.
Thanks, Steve.
If I could come up, please. The first thing to say, it's in Lichfield District, and was when I was the county council and helped to get the school in Chasetown ward in Lichfield District. But I really couldn't follow half of that, I'm afraid, like other colleagues. All I wanted to know was, are there going to be more school places for those children with more complex needs? Or were you saying, and I'm sorry I couldn't hear that, and I apologise, Chair, through you, are you taking action so there will be fewer children going into those needs, like Chasetown Community School for children with emotional and behavioural difficulties? I wasn't sure what the answer was. It's just a simple question. Well, I think a simple answer is okay there. More school places, or you're going to sort out the children so they don't have to have those complex needs. That's the way I see it, and that was my question with regard to
can I make
challenges.
Can I make a suggestion? Given we've got schools on the agenda as the next item,
well, I can do it again, but
I'd just like to sort of move us on if we can,
That's all
please. I'm told for members that the sound at the back of the room is perfect. So if members do want to change, that's fine. I will be staying here and not hearing much of the discussion. Dan.
Thank you, Chair. I think my question was sort of answered with the response that was given to Richard's question, which was I was going to ask for a more broader response as more general physical health as opposed to directionally at diabetes, but I do agree with Richard's statement.
So I think what you're saying is we've covered that, which is good news. Thank you. And let's not lose that, because I think we need to come back to it in a further session. Anne Edgeler. Right, apparently we've actually moved through that a lot quicker than I thought we were. I thought we still got another 2 or 3. Just let me ask a couple of questions, if I may, please. First of all, on page 93, and you said this verbally a couple of minutes ago, that the referrals consistently are increasing in number and complexity. That really doesn't surprise me, given what we've been through in the last 2 or 3 years, and I'm sure the cost of living isn't helping at all either on top of that. The bit that I was somewhat looking for and it wasn't there was, where is the evidence in the papers to demonstrate that? And, you know, I would like to have seen a direction of travel. How big is the problem? We know there's a problem, but how big is it? And it's not sized or scaled, and it doesn't allow this committee to then to say, are your actions appropriate to the size of the problem? And I can't see any of that, and I can't offer any thoughts. Have you got some data, and can you share with us some of what that action plan is, please?
Yep, so we do have data on referrals, so we can bring that, as you say, to a later date. I think sometimes it can be hard to compare over specific years, particularly because some of the developments that we've put in place have changed access and how that's provided, and obviously that's not just from an NHS point of view, but a local authority point of view as well. But we can certainly provide you more information around referral rates, ages, and different parts of information like that, and against obviously what we know to be, or what the national evidence tells us is the prevalent population in terms of mental health across Staffordshire. So we can certainly bring that back to you at a later date, Chair. Lisa, do you want to come in?
I don't know if it's worth mentioning that one of the subgroups, as we alluded to earlier, of the ICS board is demand and capacity, and it is attempting to get that global picture of what is demand for children's mental health services around here versus what capacity have we got in place. As Nikki's outlined, it's a complex picture because we've got multiple provision, not only from local authority commission services, NHS commission services, but schools also commission services. So I don't think we're ever going to get to a perfect answer, but we've got some work underway, and we've been supported by the integrated, I'm going to get this wrong, there's a collaborative of a consortia of informatics across the system called the IIC, Integrated Information Collaborative, I think is what they're called. And they are, we've tasked them with that piece of work at the minute. I think it's going to be a long-term piece of work. I don't think we're going to get an answer out sort of next month, next week. They're starting work with around combined healthcare data sets. That's what they've got access to. Then we'll be moving to include other providers to try, and they're using some system dynamic modelling tools to try and allow us to see where there might be bottlenecks in the system and where, if we put investment, what could happen elsewhere. Because as we've described that Thrive model, young people move around this system and move to different parts of this system. So we're curious to know about, if we put more investment in one particular part of it, what's the consequence on another. So that's the modelling work and the integrated information collaborative are supporting us with at the moment. It's quite a complex and long-term piece of work, I think.
Thank you. That's really helpful, because I think alongside the other question that Richard asked a couple of minutes ago in terms of services across the county, if you put the data with the services, we should be able to identify and satisfy ourselves of the gaps. And that's, I think, the real thing. Whilst it's really good to get a taster today, I'm not clear on the areas we should be scrutinising in more detail, because I don't have those two pieces of information which would have really given us a view. So maybe you can come back to us in writing over the next few weeks with what bases you've got, understanding that it will improve and get better in terms of understanding. And the other bit is the acuity side of things. I'm aware from work I do elsewhere that increasingly cases are more and more complex, and I certainly think in some parts of homelessness, 50% of people that we see have 5 or more complex needs. So if you've got some data in terms of the complexity as well, that would be useful. So thank you for that response. Final question from me, and final question on this subject this morning. I read in the other parts of the papers that if we went back to prior to the pandemic, 1 in 9 children between the ages of 5 and 19 had mental health issues, and that's increased to 1 in 6, which is a huge change. And that 50% of young people have a mental health problem before the age of 14. And I'm assuming that is then a problem of poor mental health through the rest of their lives, or more than likely. So I guess my question is, have we got the balance right between the amount of preventative work we're doing with children versus adults' mental health? Because if we started early, we might actually resolve some of the issues through life.
I think that's a really challenging question. So thank you for that. In terms of the NHS's investment in children's mental health, we have to grow that at a much higher rate than we grow the investment in adult mental health. So that's in recognition that we actually need to put more investment into children's mental health. I think there's much more we can do around the children's mental health agenda. And I think there's much more we can do that isn't specific to mental health, but is about those wider determinants that actually put, it increases the risk factors of poor mental health, or encourages those protective factors. And that really takes a whole sort of community, multi-agency response, and that's why it's so important that that we all work together really around this agenda. You're absolutely right about the aspect around 14. The evidence suggests that most if a child has a diagnosable mental health condition at the age of 14, they will likely take that into adulthood. So we have a real window of opportunity to do something very differently, and that's a lot of what the sort of mental health support teams that we'll come on to later is about, really about changing that dynamic. But it really does require a huge shift in terms of how we do things and how we approach things differently. And again, it goes back to the sort of slides that Lisa sort of presented around that Thrive model, and actually we've got a lot of investment in that. And I think Becky referenced it as well earlier. We've got a lot of investment in that sort of keeping people safe, you know, when they present at risk. But actually, how do we then start to release some of that into that more preventative space? Because we know those children are just waiting to come along, if that makes sense, if we don't do something differently. So I think that's about how we work together, and really that CYP Mental Health System Improvement Board and those range of task groups that we've got delivered underneath it, which have, you know, MPFT combined, Staffordshire County Council, Stoke as well, because it's across a piece, school leaders, all sorts of different people within there, to start to have those conversations as to how we can kind of start to move that agenda. But you're absolutely right, we do need to do much more in that preventative space to start to change that trajectory that we're on almost, so we can do something really different for our children and young people, because it affects everything. You know, they don't have good mental health, they don't thrive in education. It's all of those different things that then go on to have lifelong impact. So the challenge is correct, and it's one that we're looking at, and we are sighted on and are trying to move towards and engineering a system where we have those sort of quadrants, and we've got the investment where we think we need it. Don't know if anybody else wants to chip in on that item.
I think it's worth saying, Nikki, and you alluded to it, there is a prevention work stream as well of that mental health board that's looking at both sort of universal prevention, so what might be good for all of us to do around our emotional health and well-being, all young people, but also a mindful, I think, around particular groups that might be have fewer protective factors, and what might be a more targeted preventative offer. So I think that work is live and ongoing, but I think it is, as we move into things like family hubs, etc., it's how we really sort of turn the dial, isn't it, around prevention being an ounce of prevention better than being a pound of cure.
That's really helpful, thank you, and thank you for your honesty on the journey ahead on that. Okay, I'm going to thank you, Nicola and colleagues, Deb, Lise and Saab, and obviously to the Cabinet Member Mark Sutton and Becky Murphy for your input to this morning's session. There's a few actions that we've discussed. If we can see some of that coming back, I'm sure that will inform our discussion next time. So we just deep dive into a very specific area. But I think in terms of an introduction to this whole area, it's been very useful. So thank you. I'd now like to move on to agenda item number 4, which is the Mental Health and Mental Wellbeing Strategy 2023 to 2028. I'm going to hand over to start with to the Cabinet Member, because I don't always do as I should do, which is to give the courtesy to the Cabinet Member.
That's very kind of you, Chairman. I've never known you to be anything else but courteous. I always believe in setting the scene first. Thank you very much. I'll do a brief introduction and then I'll hand over to Jan, and between us we can respond to your questions. I think the first thing to say is this is a new strategy, good mental health in Staffordshire, and I mean it's good mental health for everybody, and it replaces the previous mental health is everybody's business, so it's a follow-on from that. Before I start, I would like to express my sincere thanks to this lady sat next to me, Jan Cartman-Frost. It has been quite a difficult process. It's a huge topic. There are already a lot of other strategies in place, and I was at odds to get something that would actually help us make progress, not duplicate strategies that are already out there, and therefore deliberately this strategy is high level, is a simplified document, but actually I believe that the action plan coming out of that, the fact that through the Health and Wellbeing Board they have now a more structured approach to overseeing the delivery of these strategies, that actually it will help us to move forward. I would want us to see, I know this strategy is till 2028, but perhaps in 3 years' time, we can actually say this has made a difference. Because to me, if we're not careful, we produce endless strategies, and some organisations, if it's under 70 pages, they don't think they've done the job. That is not what we are about. We are about actually making that difference. The strategy document itself, the plan is that after this presentation today, and any comments that you make, it will go to Cabinet on the 15th of March. It will have what I would call a makeover. It's a straightforward Word document. The content will be the same, but it will be presented in a slightly more upbeat format. As I say, the Health and Wellbeing Board will monitor the delivery of the action plan, and the action plan will be co-produced by the end of June. The Integrated Care Board, because this is a strategy that's had input from NHS, users, carers, a lot of organisations, but the Integrated Care Board will consider this strategy and via their normal governance processes, hopefully approve it by the end of March. I think one of the key aims of this strategy, and it's something that's recognised across mental health services, is that we avoid over-medicalisation of mental health. And actually, a lot of the users of mental health services say, if we only have access to the right information, know where to go to get it, often mental health, the lower end of mental health problems, can actually be dealt with by the individual or within their communities. And actually, if we can make that access far quicker, then you prevent the escalation then to more medicalised services. The key areas are in the document and clearly set out, items A to F, and also it sets out how we intend to achieve that. And as I say, the key aim is to make that real difference. But it's enabling people where it's appropriate to help themselves, to have access to community services, but those who do need to access those higher level services, be able to access them in a timely way. And I won't repeat comments that I think have been already made with children's services. That is also a key. So that's my brief introduction, Chairman. I will hand over to Jan. Thank you.
Thank you, Councillor Jessel. I haven't prepared a formal presentation as the strategy itself, as Councillor Jessel said, is nice and succinct, and the committee report that I submitted gave the kind of overview introduction. Just to point out, we had nearly 700 people contribute to the development of the strategy. That included over 600 people that completed a survey, and then we had a wide range of one-to-one interviews and focus groups across NHS partners, carers and user groups, third sector members, and associated partners. So we feel we had a good spread of input to the strategy, worked obviously closely with NHS partners. Nick is obviously stayed on because Nick is the lead from an ICB perspective. And we also carried out quite a bit of research on national work and legislative changes that would impact on mental health in the coming 5 years. And as Councillor Jessel has mentioned, there's quite a number of other strategies and plans that are already in place, including the early help and children's wellbeing strategy. And obviously there's a huge amount of investment from the NHS that colleagues have just been talking about in the presentation earlier. So the challenge really was not just going over the same territory, but rather pulling out the key things that we think we can work on together over the next 5 years. If that's enough for now, and I'll take any questions.
Thank you. That's most helpful to you both. I've not had any indications yet, so I'm going to start then, which is I'm just going to talk sort of conceptually on page 10. And you're right, it's a nice short strategy, 5 pages. It was bizarre that the committee impact assessment was 29 pages. Normally you see it the other way around. But thank you for that. Conceptually, under item 7, you talk about building strong and resilient communities and individuals who are in control of their own mental health. And actually, I would have preferred to have seen physical and mental health, because I think it applies equally to both. You know, individual responsibility and communities supporting those individuals on both mental health and physical health. You know, you could argue with me it's a mental health strategy, but I think in terms of trying to, you know, keep people focused, it's a strapline that can go, it's an ambition that can go across all both physical and mental health strategies. That was sort of the first point I'd make. And the second point I'd make is, in some ways the strategy reads like the mental health is a strand on its own. And actually, often mental health is affected by physical health, housing, employment, circumstances, you know, all sorts of outside unrelated things. You know, it's not often a vertical, it's often a horizontal. It's often the glue that glues things together. And I was surprised there wasn't sort of, you know, more of that tie-in to some of the other things that are contributory factors to people having poor mental health.
Thank you, Chair. From my perspective, I think it is woven through the strategy. So in the first outcome around everyone can look after their own mental well-being, that's where kind of the first place for me it links in. So 5 ways to well-being, physical activity, tackling loneliness, creating neighbourhoods, workplaces and schools. So this is about creating a more sort of environments that are more conducive to mental health as a sort of protective factor for people. Sort of community engagement, people knowing where to access support earlier on. But I think there's a number of areas which I won't sort of go, but Nikki might want to talk about. So we're certainly in the NHS area, mental health liaison services in general hospitals, so making those connections that people might go into general hospitals with a physical condition but might also have a mental health problem and how they are supported. Ensuring care is personalised to people's individual needs. So again, one of the things that came up about when in the survey, around 34% of people that answered the survey about their mental health also identified as having a long-term condition or a disability. And I think that links into the members' comments around diabetes. So that also came through when we met with service users and carers. Obviously, people don't often have just one challenge. So we have picked, I think that is picked out through the strategy. So indeed about equal access, so people are not prevented from accessing and receiving quality mental care because of a disability, diagnostic label or other characteristic, and that might include a physical or a learning disability. Certainly we had a lot of evidence presented around people who have co-occurring needs, complex needs. We obviously met with the League Commissioner around housing and homelessness. So I think in a number of areas, it's kind of woven through the whole strategy, employment, whole life experience. Nikki, I don't know whether you want to come in for anything from the NHS perspective on the links to that.
Yes, absolutely. I think it's a point really well made that you know, there is physical health and mental health are absolutely inextricably linked, aren't they, in terms of how we function as human beings. And you're quite right to sort of raise those aspects around all those wider influences that support that. Within what we sort of tried to do within the strategy is, again, sort of not reiterate some of the other priorities that are reflected in sort of long-term plans, etc., but really focus on those areas where we can jointly come together. And I guess some of that detail will come out in the sort of action planning and the implementation planning as we move forward. But things like, you know, around increasing access to psychological therapies, there's a huge mandate within there around how we increase people with long-term conditions accessing that particular service, because it's absolutely recognised that things like diabetes, medically unexplained symptoms, things like chronic back pain can result in really significant sort of mental health issues that impact people's lives. So it's interwoven in a lot of these aspects. We've got a priority there around physical health checks for people with severe mental illness, recognising again that you know, if you have a severe mental illness, the mortality gap is still about 20 years than compared to somebody who doesn't have a severe mental illness. So these things are hugely important. Really glad I picked up on the aspect around employment. Specifically in Staffordshire and Stoke-on-Trent, we have what's called an individual placement support service, which is locally called STEP-on, and it's actually one of the centres of excellence across the country, and that is purely focused on recognising the importance of people with poor mental ill health getting and retaining paid employment, and how important that is to their recovery and their ability to sort of be resilient to further episodes of mental ill health. So I think, as Jan says, I think it is in there. I think some of the action planning and the implementation planning that we'll do following this, I think will strengthen that further, Chair.
Thank you, that's really helpful. Very useful. Can I bring in Anne, and then I've got a stack after Anne.
Thank you very much. And thank you, Councillor Jesselyn and John and everyone else that's been involved in putting this strategy together. I think it's really a good move forward. My question really is, on page 12, you talk about people do not know where to go for support. Now, this is where I do feel that doctors' surgeries and pharmacies could be putting some messages out because we've got so many people that don't use computers and what have you. So bearing in mind, knowing for people to knowing where to go for support and that, if we could put some more information. I know in my own doctor's surgery, when I've gone in there, I look for information. There's nothing about mental health. And I've taken this up with the actual surgery, you know, but again, nothing there. So please can I ask that we use doctors' surgeries, pharmacies, or even libraries to put the information out there, just a phone number so people can know where to go. Thank you very much.
Thank you, Councillor Edger. So Nikki might want to come in after me on the GP issue, but just for it, that was something that came through very strongly in the engagement. So in the public survey, people were most comfortable talking about their mental health issues, either with family and friends or a professional, GP or a social worker. And actually Staffordshire's got quite a wide range of support on offer, some of it commissioned by NHS partners. And support is there for people probably early on, and rather than people waiting to access something that there might be earlier help available to them. So one of the things we want to tackle is kind of making information to the public much clearer about the whole availability across the county, and that will be work we plan on doing with public health and with NHS colleagues, and the voluntary sector, so that we try and pull together a kind of end-to-end pathway for people so they can see at what point they could access help from elsewhere. So it's not just, obviously the GP is obviously a useful point of contact, so not just sort of updating other areas like GPs, the libraries. Obviously we'll be linking in with Supportive Communities programme around community help points. One of the challenges is kind of assuming everything's digital. That isn't accessible to everybody and doesn't meet everybody's needs. So it's how we can kind of enable that information to get to people more widely through a number of channels. But it would definitely come out of the action plan. Nikki, I don't know if you want to respond on anything further on GPs.
Yep. Excuse me. So, and one of the things that we have been doing is putting in place mental health practitioners within GP surgeries. So these are it's technically called the mental health R's roles, the additional reimbursement roles scheme, but they're mental health practitioners essentially that we will have this year and next financial year for 23-24, we'll have 3 mental health practitioners in every primary care network across our patch. So that's part of the offer that we're putting in place to try and increase that sort of access around mental health, recognising that sometimes what people want isn't actually the GP. They need a different type of help, but they don't quite know where to get access to it. Something else that we've been really promoting is the 24/7 all-age access lines that are in place across North and South now. But I think it's how we get that sort of information more readily accessible out there. So it's one of those things, you don't know what you need until it happens, doesn't it? And then sometimes it's hard to find out where to get that information from. And I think it's about really trying to understand what people's help-seeking behaviours are and actually where we can get that information best placed. But in terms of the GP practices, that is something that we're trying to work on in terms of having those dedicated mental health practitioners that are available for people to access to get that direct support.
Thanks, Nicola. And obviously within GPs there are a number of social prescribers within those practices as well. But please don't forget the role of counsellors as community leaders and community champions, because they have huge numbers, and Anne's a good testimony to this, huge numbers of contacts with lots of people every day of the week. Anne, we're with you.
Yes, thank you for that, and thank you, Nicola. I mean, it's not. I mean, I know these people are in place in some doctors' surgeries. It's not that. It's the actual written information. As people are going in for something else, and they think, oh, my family member could do with, so it's a booklet or a leaflet or something on a notice board. Thank you.
Thanks, Anne. I think you've made that point, and it'll be picked up as part of the action plan that Jan's just been talking about. Can I just... I've got a fair long list at this moment in time, so let me go to Keith first. Can we be brief, please, Keith?
Yeah, apologies for leaving the meeting. I was just called to another meeting I wasn't aware of, so I had to go and cancel that one and come back in. So if something's repeated on this, my comment really is just from the experience I've had of going through in relation to mental health and all-party working groups and everything else, from going back ever since I was a county councillor, really, was that there are an awful lot of strategies. I think we've already mentioned that. There's an awful lot of different groups that can bring people into those services or make the services aware that other people might need those services. That's sort of the two-way process that occurs for people to come into mental health services. I've written down here about 8 different ways of getting into the service itself. My concern has always been is both overlaps and also gaps between those services. And I just wondered if there could be something written into the strategy to make sure that there's some awareness of that, so that when people are looking at the strategy overall, that they are aware that it's not as simple as it may appear in the first place, but likewise, we don't want to overcomplicate it. And I just thought that there could be an opportunity here to try and produce some sort of linear process that we could then communicate outside all of us here that had some experience in what we're talking about into the real world. And not saying we don't live in the real world ourselves, but in terms of just how people who aren't here, don't have that experience, haven't been working with communities and everything else, who might need some mental health, that they, because you put down here self-assessment, to have a simple linear process that they could understand and perhaps be more happier to work with, rather than having to look at all these different balloons and everything else all over the place.
I think the Cabinet member is going to pick up the answer.
Yes, very simply, totally agree with you. But issues like that will come out in the action plan, because it is for people to have access to their information so they know what's available, know what help is there and how to access it. A strategy sits that little bit higher level, but I don't disagree with you. And I think, everybody involved understands that actually sometimes we overcomplicate things in managing demand That's sometimes what we do. And actually, people want access to simple information so that, you know, they may be able to solve their problems with a little bit of assistance, but we do need to make it simpler and accessible. But that will come out in the action plan. Chairman, could I also say, you are aware I'm chairing another meeting.
Very shortly, I understand. But while we've got you, can I just ask a follow-up to what Keith's been talking about? And it touches what Anne was talking about, which is the action plan or the work that goes underneath the strategy. This is going to Cabinet in the middle of March. When's your aspiration, given it took us a little while to get these 5 pages? What is your aspiration for bringing back the action plan, please?
June.
June this year?
Yes.
Perfect. We look forward to seeing you back in June. That doesn't mean you can all disappear, because there's a whole long list of people. But Charlotte, please.
Thank you. We learned during the pandemic that getting out in the open air, getting close to nature, was good for mental health. And I wondered, therefore, what was in this strategy to support community projects which are out in the open air, which bring people together, countering loneliness, but also getting people involved in growing stuff, maybe doing pottery and so on. Because in my experience over the last few years, the County Council has presided over the closure of one of my local projects, which was run very much on a shoestring, which was situated on County Council land, closed. And another project, John Hall Gardens, the County Council withdrew its commissioning support from that project, which was run by Rethink, to give it to Midlands Partnership, I think. And as it happens, that project is just about surviving without any support from the County Council. So where do these community projects fit within the strategy? Are there community projects similar to the ones I've just mentioned elsewhere in Staffordshire? Because it seems to me that we have the advantage of having a beautiful county with plenty of open space. And I just wondered where that preventative agenda fitted in, because one assumes that what we're trying to do is to prevent people getting into mental health crisis. And these projects have a proven track record in doing that.
I think I know the answer that's coming. Jan.
Thank you, Councillor. For me, this sits under the kind of enabling everyone to look after their own mental well-being and find support in their communities. And I absolutely agree with the member. So one of the things that came out in the research we did, and it is referenced in the community impact assessment, is the positive effect on people's mental health and well-being in being out in green spaces, doing physical activity. So I would expect us to link, so in the strategy it references to connecting around better health Staffordshire and the creating neighbourhoods and spaces achieving good mental health. So I think through the development of the action plan, particularly around the voluntary sector, communities, and that would be something certainly members would be able to support with, I think, is how we make that connection through the action plan to people's well-being in terms of accessing, as you've said, Staffordshire, that is something Staffordshire's got a real advantage, is access. What that is one of the questions we asked about in the public survey about do people make use of local spaces and green spaces. One of the things I think coming out of COVID and when we did the engagement is, again, people still were experiencing some anxiety about going back out, but what was good was outdoors activity was something people had continued to access, and the voluntary sector had responded to that. So there was quite a lot of walking routes and things like that. One of the other things that we did pick up, though, is people with other health conditions sometimes needed support to get outside. So that might have been transportation or a buddy. And so one of the other pieces of work we're doing is around travel training and buddying with public health, which would help people to access open spaces where they're not able to. So I think it will be picked up definitely in the action plan.
Can I just bring in Nicola, who wants to come in on this? Nicola, I don't want to talk about the two specifics that Charlotte raised, so I just want to talk about the principle that Charlotte raises, please.
Yep, so I think it's just recognising obviously that the county has a huge amount of assets in terms of its green space, and it's not necessarily always about mental health services to delivering or leading, but actually community assets taking that drive and that forward and actually being inclusive of people with mental health needs and mental illness. And I think that's one of the approaches that we're supporting. We've actually been working with the Stafford Community Foundation to deliver a sort of grants programme to start to build some of this community strength. The focus this year is going to be around young adults, but it has different areas of focus. It's very much how we work with those communities to develop those assets and be inclusive of people with a mental health issue or a mental illness. Thank you.
I just wanted to follow up to ask if there are any particular projects which anybody can point to which are being supported as community projects which capitalise on the open space and the environment which Staffordshire has to offer, because I'm not aware of any such projects which are being supported, but I would be very interested to see any projects which are being supported as an example to the rest of the county.
I'm just going to sort of hold the sort of conversation until June, because I think actually to have that conversation moves off the strategy in front of us. What we're trying to discuss this morning is the strategy. I think what you're into is the next level down, which is the actions and the action plan that comes from that. And then I think it would be a worthwhile question in June when we see the next piece of work, but I can't see how it links to...
So people have to wait even longer for some sort of action.
No, I don't think that's what I'm saying at all. I'm just saying you'll get an answer when we have the next piece of work, which comes from the Cabinet member and from Jan in June. That's what I'm suggesting. Jill Hood.
Thank you, Chairman. I'm also returning to item 7, individuals who are in control of their own mental well-being. I meet hundreds of elderly people every year, possibly even thousands. I'm afraid that there are very few of them that would be in control of their own mental health. And the saddening thing is that they very often don't realise that they do have a mental health issue. And the annoying part is that we've touched on it so many times that mental health does manifest itself physically with some people, particularly the elderly. And they go along to their doctor, and the doctor probably has recognised that their mental health is in a very bad state, but is too busy to sit and talk to them about it. And I really worry about who signposts them. You know, we've not got many professionals in the voluntary sector. They are invaluable, but we have very few. And to meet someone who is extremely distressed, and you can see that they've got problems, and suggest to an elderly person that they perhaps should go along somewhere is sometimes extremely insulting to them. So I'd like to reiterate really what's been said. But my second point is alcoholism, which I think recovering alcoholics are failed, hugely failed. And I've been in this chamber and we've had various people come from an agency and talk about what they're doing, but never, ever have I heard one of them say, this is our success rate. I know that we're, you know, GDPR, confidentiality, etc., but I would love it if just one of them came along and said, this is the success rate we have within Staffordshire or within our agency. There are just so many people with alcoholism, drug addiction, who are struggling right now. And I will say it yet again, what we offer is woeful. But I thank you for your presentation.
Jan, is this with you or with Nicola? I mean, the first question related to GPs and the second related to alcoholism, which is maybe slightly off the subject of mental health strategy.
If I just touch on the alcoholism, which, although it's to me it's sort of included, because what we have referenced to people with co-occurring needs or a range of challenging issues. And Nikki might talk more about this, but certainly there is a service around complex needs that started recently, that Tony Bullock, who's the lead commissioner for, and this is addressing specifically this problem. Tony Bullock gave a sort of presentation to in part of the engagement about these particular challenges for people of where individually their needs might not kind of meet statutory threshold for services, but collectively they are people who have very complex needs. We also heard this from housing colleagues, and I attended a couple of the vulnerability hubs virtually that the districts run, which is multi-agency police, fire, social workers, housing, and those sort of issues absolutely came through in the cases they discussed. But I think the service that Tony Bullock is initiated with NHS colleagues absolutely seeks to address that problem. But for me, they should be through this, because these would be people who would have other challenges around housing, employment, physical health conditions. Again, that probably Nikki's best talking about health checks and similar. So, I don't know, Nikki, if you want to come in on that and the GP question.
Yeah. Thanks, Jan. Thanks, Councillor. So in terms of the GP question, I mean, again, part of those mental health practitioner roles is around that. It's that recognition that sometimes GPs often don't have enough time to do the kind of detailed work that they have in that sort of short session. And these mental health practitioners can do that additional work and follow up as necessary, that are wrapped around GP surgeries. I think you're absolutely right to say there is an under-recognition of poor mental health in older persons, and I think that is an area that we absolutely recognise. We've been doing a lot of focused work around not just young adults and adults, but also older adults, and actually trying to understand what it is we need to put in place to meet their needs better and differently. And again, that will form part of the action plan. But there's definite efforts to increase access for older people, in particular, to mental health services. Just picking up on a sort of co-occurring needs aspect, I'm sure Councillor will have heard or had many councillors in this room experience of people almost being bounced between alcohol services and mental health services. You know, you can't access the mental health service until you're alcoholism is sorted out, or vice versa. And actually that's the provision that Jan's talking about, that we've been working with Tony Bullock on around, and it's called the ICON service, which is essentially one team for people with co-occurring needs, drug, alcohol and mental health needs. It's exactly about preventing that bounce between services. It's very much focusing on the client and not their condition, and it's only very recently launched in January, actually, so it's quite new in its inception, and we've had to overcome really significant data sharing and challenging agreements to make sure that that's in place and we can operate that team approach. So again, there are things that we're doing and there's more we can do, and hopefully you'll start to see that in the action plan as we move forward.
Jill, just for you on this, I suggest once we've got the actions from the strategy and we've looked at the gaps that we referred to in the last session, we may well just want to pick up some focal areas, and that would be my suggestion here. Do you want to come back on anything? No. Okay. Philip, we're with you. Good morning.
Morning, Chairman. Yeah, I've been listening with interest. I woke up when I'm going on about people didn't know where to go. I did a mental health and wellbeing in the workplace advocacy course in August this year, mainly because my real-time job of being a farmer, we're having about 3 suicides a week at the moment with the stuff that's going on, and I thought that I ought to be doing something for my community. As a result of that, I discovered a whole host of things that are going on, completely missed in this report. And actually, as pretty typical, ignored totally, because I did conversations like many councillors do, but some don't. I discovered that the NFU Mutual, for example, when they're going around seeing farmers, have to put tabs all the way down, making notes of how their clients are. The agronomists do as well. RABI are running courses available for anybody who wants to do them. I'm quite sure most of these would not want the bureaucracy that I've listened to for about 40 minutes interfering with what they're trying to do actually on the field. I discovered that JCB managers are all going on mental health and wellbeing courses. They all tie in with what's going on at home and what's going on in the workplace. One of the reasons we as farmers are losing people is because of bullying in the workplace. There's a whole host of stuff going on there. I've listened very carefully for 30, 40 minutes. There's things actually going on out there that are helping people. The last place I'd send somebody actually is a GP. They've got enough on the plate. And it'd probably stress the person out trying to get in. I think probably more likely is to take them for a quiet talk somewhere, some practical help. One of the first issues, I've actually through the harvest had to point out to somebody that the amount of work that he was putting on one individual would be impacting that chap at home, and there was another guy working at the problems he'd got at home with the family would be impacting his work. So it's simple things like that so that employers can help their employees who all have elderly relatives, young children, whatever it may be. And there's not a mention of this in this report. It just seems to be an excuse, chuck more money at us and we'll carry on as we are. The communities are helping themselves.
Thank you, Philip. Jan, do you want to come back on that one, please?
Yes, thank you. Thank you, Councillor. There's a good workplace mental health offer already offered by the County Council, which a lot of employers have already signed up to. So Councillor Atkins is right, there are already things in place. So that, again, we're not trying to replicate that. What we are aiming to do is talk about including the strategy, the aim of having workplaces that are conducive to mental health, which I think is what Councillor Atkins is talking about. And actually, if you get communities, employers, schools on the same page around how you can help people's mental health, then everybody will be clearer about where you can go for support, because I would agree that there are a lot of things on offer, and that came through again from the public survey, is that we are seeing lots of good things already happening in Staffordshire that people may not be aware of, and some of the work we need to do in the action plan is kind of bring those to light so people know where to go and at what point. And I think the key thing for me as well would be producing that with people who are trying to access the information, because it's quite hard when you've got lots of access to contacts, you understand the system, to make assumptions about where it's obvious. And I think that is sometimes the challenge when we're doing that internally. So one of the key things for me is asking people who are trying to access support how they're best, how that would best meet their needs. Does it work for them? So I think I did have opportunity for an NFU rep, I think some time ago, through the Stafford Mental Health Network. So we had an armed forces rep through some of the ad hoc discussions we had, or focus groups. Some of those similar points were made.
Philip.
Thank you, Chairman. I think one of the things that Jan's got to take account of, there's some large firms like JCB who've got a programme in, NFU Mutual, and the agronomy firms like, there's quite a few of them. But the lone workers, like my industry, where you're a farmer working on your own and maybe 2 employees, is a totally different story. You haven't got time for this. You've got that much bureaucracy coming at you anyway. I've just had to fill in an RLE1 form with an 87-page booklet explaining how to do it, and an LTA1 form with about a 46-page booklet explaining how to do it. That's on top of your day job of ploughing, sowing, feeding animals and whatever. So you've got a lot of pressure. So what the industry's decided is the Royal Agricultural Benevolent Institute, RABI, which is a charity, will provide training, and then the industry's main helpers, and there's a whole host of them, but the NFU Mutual and agronomists, and actually agronomists get bullied no end of the times, they can do the courses to help the others because people don't know where to go. Jan's quite right about they don't know where to go. They don't know they've got a problem. You know, it could be a relative who's dying or severely ill, or they've just had a bad accident. Don't have to remind you, we get 50-odd people killed every year in farming. If it was the county council, that would equate to about 5 or 6. There'd be hell up. So, you know, you're going off down the tangents of people who can help themselves, and then there's others who aren't in a position to. And I bet there's other industries that are exactly the same. Hospitality trade, what goes on there? Who knows? So there are methods of helping people, not through pharmacists. The people I'm talking about would never ever go to a pharmacist and ask for help. They never go to the GP because that's for somebody else. So I think there's some easy targets and you don't have to worry about that. And there's other ways of doing it. And I was just thinking about it, and it's a bit like horse racing, which is one of my keen hobbies. And I just couldn't make my mind up whether they got cheek blinders on, the blinkers, or they got a hood on, because you need to do that and remove the blinkers and look outside the box.
Thank you, Philip. I think the challenge, probably back again, is that when we get to see the action plan, you know, we've got to make sure that it is as holistic as you indicate. And, you know, and I think they're trying to keep it high level.
At 3 a week, that will have been nationally about in 3 months' time, let's say. That's 36 people committed suicide in my industry.
Interestingly, I was going to pick up your point about suicide, because I think you make a really point. Under page 17 of the strategy, part C, where it talks a timely response to crises and a system-wide approach to suicide, to reduce and prevent suicide, which is in part what Philip's talking about. I do think there is probably a bit more we could put to that, which talks about maybe signing up to a suicide prevention action group, because there is a couple of those nationally. And second of all, I think that we should be providing partner-wide training or encouraging that. And I know that North Staff's Mind, I think, did some really great training, really engaging training on that. And I would encourage just maybe just a direction of travel there, rather than just something which is quite bland. You're going to tell me it needs to be in the action plan, though.
No, thank you, Chair. Just that's one of the existing strategies and plans that we are not replicating by this, but referencing. So there is already a Staffs and Stoke Suicide Prevention Partnership Plan that's in place, and that is the training and reference, which is the Talk Suicide campaign and training, which has proved to be very popular in terms of rolling out. So the again, the specifics around the suicide prevention work is covered in that plan rather than this one. What we will be doing in the action plan will be identifying any key indicators that we would want to incorporate in this action plan. It may be delivered through the suicide prevention work, but where in terms of delivering on the whole strategy, we would want to reference the outcomes from the suicide prevention plan. It's absolutely a focus already in place. Nikki, I don't know whether you want to come in from an ICB perspective on that work.
It's just to reiterate what you said, really, Jan. So Dr. Weed Abbasi chairs that group. It's a multi-agency partnership group. And I think just picking up on the point around training, I think you're absolutely right. It was incredibly valuable training, and I think that's something that we need to pursue. One of the other things that we're looking at specifically, just thinking about the councillors' experiences, we're looking at putting in place a suicide bereavement suicide service, recognising that individuals that have been impacted by that have the risk of their mental health is quite significant as well. So those are some of the things that we're starting to plan for moving forward.
Thank you. And let's make it as simple as possible, because when you've got strategy after strategy after strategy, frankly, you know, if you're in a place, then actually, let's make it really dead easy, please. Sorry, that was a poor choice of words. Dan.
Cheers, Chair. Just wanted to pick up on point D and maybe a bit of clarification from the NHS rep. There is equal access to support to improve mental health wellbeing and services to manage mental health problems. You spoke about mental health practitioners being in surgeries. We had the Midlands Partnership Foundation Trust at a borough meeting a couple of months ago now, and that was one of their main things that they wanted us to focus on that was good and that was happening. And my question to them was, how many mental health practitioners were in Tamworth in the surgeries? And the answer was none, because the PCN had rejected the offer. So how many PCNs have accepted the offer across Staffordshire?
If you need to come back, if there's a piece of detail there you need to come back on, then please do say that. This has come up before, and I think it's a really valid question, albeit it doesn't strictly link to the strategy.
So I will come back with that information. So Councillor's quite correct in that we're just working with the PCN about the Year 3 expansion and how we can work together to ensure that there are access to mental health practitioners. In terms of the actual numbers that are in post across Staffordshire, I'll just need to come back with that detail. I know across the whole of Staffordshire and Stoke-on-Trent, but not specifically Staffordshire, so I'll need to come back with that detail.
That's perfect. What do you reckon, a week, 2 weeks?
Yeah, certainly, yeah. A week, yeah.
Does that satisfy you, Dan?
Yeah, thank you, Chair. Maybe looking forward to see something about in the action plan if PCNs aren't the reasons why, and how they can both work together to get these practitioners in the surgeries so it's equal, as point D says, across Staffordshire. Thank you.
Thank you. Steve.
Please, I'm always interested to hear Councillor P. Atkins, because I'm from the other side, the other end, if you like, the farm workers' stock, as he knows, and certainly the mental health that especially farmers on their own when they get older and not able to do things, it does concern me. So I hope that the strategy does actually pick up on what Philip has said and actually does think, how do we reach those people? As with older people who live alone, they're always hard to reach. There's no newspapers, they may not go out at all. So they're always difficult. It's not easy, it's difficult to reach them. But I think with the NFU there, that you could actually help to do that. My question was really about Councillor C. Atkins' question earlier. I mean, it's about the strategy, and the strategy says the approach to achieving these outcomes will be, two of them, build and use community capacity to support people with mental health problems and promote independence by offering support and service to people as close to home as possible and the least restrictive care options. So the question about what projects are supported by the county, I think is legitimate for the strategy. And whilst I don't expect to get an answer now, hopefully we can get an answer long before the action plan, because it's something that should be known about now. It's not about action. Unless we're saying there's no action, there will be action. Presumably there are projects that are being supported, and a database of that would be very helpful, I think, Chair.
Okay, I mean, I think it's up to local councillors to understand what's going on in the local area and challenging and championing that. I don't think it's for the Health Scrutiny Committee, with the greatest respect. If we did that, we'd be into every level of detail. I'm happy to have a different alternative.
Why can't we have a database of the whole of the county? What's wrong with that? This is where decisions are made, so in this chamber, in fact. So.
Okay, but I don't see what the purpose is when we're scrutinising the strategy which is in front of us. So if you can make it related to the strategy, I'd be more than happy to take the question. At the moment, I can't see what the link to the strategy is.
Okay, C, build and use community capacity to support people with mental health problems. D, promote independence by offering support and services to people as close to home as possible and the least restrictive care options. Those sort of things are actually available if there are pottery classes and gardening classes and all sorts of things like this. And that is what I thought Charlotte was asking about. And I don't see why there can't be information on that. I can do an FOI if you like, but I just wonder if it was able to get through scrutiny.
You'd have to go elsewhere for an FOI. But the point is, I don't think it is for this committee to create a list of every community asset in the county that exists. I think that is outside of the remit of this committee. And if you want to go and have a chat with Councillor Victoria Wilson, who looks after communities, which is a community asset, then I'd welcome the councillor to do that. I do have one other point I did want to pick up. I'm not seeing anyone else indicate. The point I wanted to pick up was on outcomes under A. And I just wanted you to reflect on the use of population health management, given that the ICB is integrating data. I think there are ways of finding some of these people rather than just waiting for them to pop up. Some of the people who've got poor mental health, you know, some of it is very predictable. I don't think it's as predictable as Philip's Farmers, but I do think that, you know, if you've got a partner who you've lost who's been long-standing and you become very lonely and isolated, you know, that is the start sometimes of poor mental health. And I think that I would encourage you to use some of the assets within the wider ICB to really use data in a really sensible way, because the sooner we can support people and help people, and it can be as easy as Steve talks about, using community assets. You know, if I know where someone is in my community, I can go and knock on the door. But maybe you could take that into the account in the strategy, please, Jan.
If I just quickly come back on that, I completely agree about the importance of us using population data, which we did in the preparation of the strategy, and particularly in D there about equal access to support. So it links slightly in there. We will have better data and insight about the mental health needs of different groups in our population. That might include, so we have got some data about local areas that we've referenced in the strategy, but I absolutely think the work, in fact I've made a note of the IICS that they talked about earlier, and that's about how we can inform that, the strategy, the action plan and the longer term prevention by using data about earlier issues that will help us to kind of prevent things longer term. So I take on board your comments.
Jan, thank you, and can you pass on our thanks to the Cabinet member? You're welcome to stay or go. Hopefully you've got the feedback of committee, and you'll feature much of that into the action plan which is there. And Nicola, thank you also for your input to this item. I'm happy to move on to the final item of this morning's agenda, which is about young people and schools and mental health. Now, I know that the Cabinet Support Member has done significant amounts of work on this area, and would you like to introduce the report?
Thank you, Mr. Chairman, and thank you, councillors. I won't beat on too long about this because I think you're struggling for time, and I'd rather the debate carry on really in terms of this. You will have all no doubt received the report that Deb's kindly distributed to you all. This is where we are now in terms of the work that's going on in schools, which I was asked to look at as part of my remit whilst it was your Vice Chair, Mr. Chairman, as you know. This is to update members in terms of where the next steps are, the next round of bidding to take us up to the 2024 in terms of the whole schools approach. It's been very informative, Chair, listening to the debate this morning on the other areas of mental health, because as you know, this intertwines with all aspects of our society and not just one in its separation. And that's where the difficulty is. And that's where I think the positive work can be reflected in this work being done and will be rolled out in the further phases through 9 and 10, is that it's important to recognise that what is mental health is different to another person's idea of what is mental health. Where the positives we can do is to pick out the things that are most salient in terms of early referral rates, to get to the nuts of the problem before it gets a chance to have that impact and the costs implications as further down the line as the child moves through adolescence and into young adulthood. This really is good work, I think, that can be worthy of its use, but it underlines the commitment from the NHS to fund another £2.3 billion a year by 2023-24 to look at the whole school approach, to look at creating that culture within a school where children feel confident about raising issues. That's what crucially this is about, and to early signposts where there are significant problems to the right area. Now you'll see from the data that's included in the report that there's a whole aspect that's devoted to anxiety and to depression, and I think that's where the areas that needs to be drilled down in terms of where service delivery can be used to exactly what is causing that. Obviously the cost of living crisis and everything else that's going on at the moment. This is going to impact on that, but it's far too early yet to say for definite where the work can be done, but this is an early good start in identifying what can be done in schools, and I recommend that to your members, Chair. And happy to answer any further questions, should you wish.
So, Paul, thank you for the excellent work that you did in this area whilst you were the Vice Chair of the Committee. Can I just see whether Nicola wants to say any words in addition to what you've said?
Yes, thank you, and thank you to Councillor for all his support in terms of this, really important agenda item. I'll just give a really quick overview because I'll just take the report as read. So the Trailblazer programme launched in 2018, very much led by the Department of Health and Social Care and the Department of Education in NHS England, and that's really in recognition of the fact that we can't do this in isolation. This absolutely is a multi-partnership approach to delivery. It basically created mental health support teams and specifically education mental health practitioners to work directly with schools and colleges. And there were three key functions, or core functions to that. So to provide direct support to children and young people with mild to moderate mental health problems, to work with the senior mental health leads that Becky talked about earlier and other staff in education settings, to develop that whole school approach, and to give advice to staff in education settings to ensure that children and young people get the right support and are able to stay in education and not diverted elsewhere. As the councillors rightly articulated, it's part of a multi-year programme that we've been working towards, and we were really successful in Staffordshire being one of the original trailblazers. So we've been able to build on that throughout successive years, ultimately meaning that by March 24, we will have at least one mental health support team in every district and borough council area in Staffordshire. And I think roughly we'll probably have about 40% coverage of educational establishments at that point. So it's a really welcome provision, and it's one obviously we intend to, given the opportunity, to expand further into 24-25 as well. We're just awaiting the national guidance on that. Conscious of people's time, so I know people probably want to get into questions in detail. So if it's okay with you, Chair, I'll hand back, and we've got the same colleagues here earlier to help support those conversations and give you a rounded response to questions.
Thank you. Let me bring you back in, Paul, please.
Thank you, Chairman. Just a brief comment that you'll see the report is warts and all. There are significant challenges. For example, all schools haven't been willing parties to engage with this, and this is work where we need to work further in the future. Thank you.
Thanks for that. And now I delayed a question from Steve earlier, and to take it in this item. Are you ready to ask that question now?
A few questions, if I may, but that one I can repeat, which was, as I'm chair of Chasetown Community School in Lichfield District, which is a school for children with emotional behaviour difficulties, or whatever the latest phrase is now, but they're still the same children with mental health problems and have an autistic spectrum and so on. And my question was whether there was, because the references are increased complexity and so on, and that's what we have found, at our school, that the children have more complex needs than even before, and that we're oversubscribed. Whether there was a recognition of that, and if there was, how are you going to deal with it? Either increasing school places or else trying to deal it so that those complex cases don't actually get that far. That was my first question, or my earlier question. Thank you, Chair.
And I'll bring you back in a bit later for some of the others. So this is really about a capacity question, Nicola.
Yeah, so, and apologies, Councillor, I misheard earlier. I misheard, you said Chasetown, and I misheard, so I do know Chasetown's in Lichfield District Council. I think in terms of this, it's a complicated picture. So it's how we work with our education colleagues in terms of those placements and those who are overseeing SEND, special educational needs. I'm aware, obviously, there's work ongoing at the moment around the accelerated plan in terms of looking at the options as to what we can do to provide those places, but also actually support mainstream settings to be able to more effectively support children and young people that have those needs within those settings as well. So I think can see Becky's got a hand up, so I'll hand across to Becky if that's okay.
Yeah, absolutely. It was just building upon that point that I think the work that Halit Halusi is currently leading on of that review of special provision is absolutely going to be looking at that question in terms of what are the needs, what's the demand, and is the capacity there to meet it. I know one of the work streams under that overarching banner of the review of special provision is looking at emotional health and well-being, which includes kind of positive behaviour support, mental health and well-being, emotional regulation, etc. So that again, they are looking very closely at that and identifying what do we need to do in Staffordshire to meet those needs, and what additional capacity or resource might be needed, both in terms of places for those children, but also that wider support for schools, so actually they can provide the support for children in their mainstream settings without the need to remove them into special settings. So I don't want to say too much about that because I'm on the periphery of that project, but I know Halit Halusi is leading that work, and there are some proposals that are in development as we speak.
Steve, back with you.
Thank you. Thanks for the answer. If I can go on to another question now, or jump to, which is paragraph 4. It says in England today, approximately 1 in 6, 17% of children and young people aged 5 to 19 have a diagnosable mental health problem, which is an increase from 1 in 9 in 2017. Now, in that report, which is actually a survey done 2017 pre-COVID, and then at 2 occasions during COVID, and that, the word diagnosable is not used. What they say is probable mental health. So I don't know why that word was changed. They don't say diagnosable, and I do think there's a difference between diagnosable and probable mental health issues. That's that first question. If I could perhaps have a straightforward answer to that one.
I guess that's a point of language. I think when we talk about diagnosable, it doesn't mean that there will be a diagnosis. It equates to a similar thing, but I take the councillor's point on the issue of language. So apologies if that misrepresented somehow, but it was written in terms of the same. It's a potential diagnosis or it's a probable condition. It was written in terms of the same aspect, but I take the point on that the survey detail didn't specifically use that word.
Okay, understand.
Okay, thank you. And the question about paragraph 7, this is just a little bit further on, and this is just to help me. There may be answers in there, and previous meetings would be able to understand it. But it says in paragraph 8 on the next page, I think, yes, page 8, paragraph 8, in Staffordshire and Stoke-on-Trent, this meant that only 4 CCG areas at the time were eligible to bid. We were successful for 2 CCGs for the wave 1, 18 to 19 and so on. I just wondered why that, help me, why that was. In a nutshell, why were they those few only successful in bidding for that funding?
Yeah, so at the time, obviously, when we were CCGs, we still had the mental health investment standard. And if, obviously, at the time we were 6 CCGs, obviously 5 in Staffordshire, 1 in Stoke. And if that CCG at the time of the bidding process did not meet the mental health investment standard, it meant they were ineligible to apply. So at the time, there were only 4 CCGs that had met that standard going back into 2018-19. So it was only those areas that were eligible to apply.
The last question then, if that's okay, Chair, which is quoting from the survey that was referred to earlier, household circumstances since August 2020, for 8% of children aged 6 to 16 in 2021, parents reported having recently fallen behind with bills, and for 4%, parents could not afford to buy enough food or had needed to use a food bank more. So that was about the anxiety caused by the bills. And of course, I think very soon, if you haven't already done it, I don't think you have, you're going to put the council tax up for abandoned property by £70 a year. I just wonder if that would help or not help anxiety for those having to find those bills.
I think you'll know which parts of the question to answer.
I think the cost of living
crisis... It's probably a political question for a political answer, actually.
We don't deal in politics. We don't deal in politics we don't deal in politics in this chamber. Health.
This is just so ridiculous. That is so ridiculous.
Thank you. We'll move on to the next questioner. Keith Plunder.
Thank you, Chair. I'll try and keep politics out of my answer the question. Okay, absolutely. Right, I'm basing my question at the moment on several school visits. I'd like to, Jonathan Price and others have been, as you and other people know, that I've been dealing with some schools and some issues. I've got a pressure group in my own division at the moment and others, so I'm not going to go specifically into Biddulph and everything else, and there's plenty of work going on there in the background to try and find out the reasons. Some questions I've got at the moment. There seems to be a difference in the way that these mental services are being supported or at least being processed between academies and the schools that are still being looked after by the local authority, namely ourselves. And there's also a difference between those schools that are in a 2-tier system and a 3-tier system. So I just wanted to make sure that whatever we're looking at here takes those differences on board, and like to try and get some response back from the officers about how that might be being looked at. There's also issues around CAM delays, which people we've been, looking at that on a constant basis for as long as I can remember being a county councillor and on this committee. To the point where recently I did a visit to the academy. It was actually in Stoke, but it carried over at most of our areas, a massive academy. And they were saying that the delays in CAMs, particularly for older children, once they get to 14, 15, can be months, if not years. And by the time they get it, they've gone past the school age of 16, where it can actually be applied, thus leaving the academy and the school with no additional funding to be able to look after that child, even if they've been diagnosed. So I am fearful at the moment that things aren't where they ought to be. There's other things, but I think I'll leave it to those two questions. How can we improve that service to older children that should have been picked up earlier, but were not? And I think that's the whole thing that goes back to the strategy and everything else we've been talking to earlier in this meeting, and about the differences between tiered systems, the size of the economy, the academies, and everything like that. So it's specifically around schools, if someone could give us some questions about that, across the whole county I'm referring to as well. Thank you.
Nicola, are we with you?
Yeah, so, excuse me. So in terms of the mental health support teams in schools, they are only available in a limited number of educational establishments still, unfortunately. As I said, we have got very good coverage in Staffordshire and Stoke-on-Trent, or will have, probably better than a lot of other areas, but that still means there's a huge gap. And with some of the academies, it can mean that one of the schools has a mental health support team and another doesn't. So that does create those sort of complications, you're right. So there has been some barriers around that sort of cross-academy working. Having said that, there's been lots of benefits to the cross-academy working as well. So that's one of the points to raise. In terms of the mental health support teams in schools, and I take your point about the sort of older children, that's when they're sort of getting a diagnosis, and that's the premise of the whole ethos of the mental health support teams in schools is that we get that in there as early as possible. We build that whole school approach so that actually or children have identified really young that do need that specialist support, and we can put them on that right pathway so they're not actually going into sort of teenage years with a mental health condition. So that's the kind of where I would come from it. I think, Deb, if you want to pick up some elements around the particularly the cross-academy aspects and also potentially the waiting lists as well, if that's okay.
Yeah. So from a cross-academy, yeah, we do realise there is that inequality, and that some schools in the academy are under the MHST and others aren't, which is disappointing, but we're limited to the number of schools that we can actually cover, given how it's the rollout of each wave. But benefits we've really seen is that if we're providing training, for example, to teachers around sort of mental health awareness or things to look out for, we look at it as in, if we go to a team meeting of across the whole academy, as long as one of those schools is in that academy, then we're providing the training. There's all that shared learning, so we invite everybody in. So there is that sort of cross learning. We also find that a lot of the sort of senior mental health workers will work across the academy. So we will sort of ensure that we deal with that mental health lead while they're in an academy within one of our Trailblazer schools, and then that learning is shared out across the whole academy. So there are benefits. It also gives us a really good platform for those future waves to then to put that bid in to NHSEI, because we have many schools across Staffordshire and Stoke-on-Trent who are parts of academies that other schools are in, and they want to be part of it, which is really, really good. It gives us that strength when we put forward further bids as well. So I hope that does reassure. We do recognise there's challenges, but we're trying to spread the learning as best we can within that sort of tight framework that we do have. And then secondly, with regards to weights, I would be quite interested to speak to the councillor, and I'm happy for him to contact me outside of this with regards to weights in North Staffordshire and Stoke, because I am unsure of them, apart from one team, that any weight would be more than 12 months. I think we hit all KPIs for RTA, which is referral to assessment, within 18 weeks across North Staffordshire and Stoke. But obviously, we need to find out where those blockages are and those concerns are. And also that there is no priority given to age within a referral system within North Staffordshire and Stoke. So it's just to give that assurance. But again, happy to speak outside of this meeting.
Keith. Thank you, Chair. I'm quite happy to let you know. I don't go into great details at the moment, but just to let you know that it's even worse than that, Jim, as they say in the business. I'm aware of a school at the moment that has trained up and put a unit together to keep the children with mental health issues within the mainstream educational system. They've put this unit together. It's part of the work that we've been doing on a much general basis. And because of the increased cost that they now face in terms of fuel bills and everything else that are coming out of it, the point that they can't necessarily recruit teachers and others to get that specialist training to be able to support the unit and everything else, the whole thing's just been put on ice. And for me, I think that's an important part of what we're trying to do, is to, rather than escalate these issues with children as they go through life and into teenager years and then into adult services, which, okay, it's not part of today, but that's where quite a lot of the people come from, is to go into the adult mental health services and everything else. Surely it'd be easier for us to try and find some funding from somewhere and support the schools who are actually trying to do things that Anne and others have been working on for many, many years, to try and keep those children in specialist units within the education system and for their mental health issues not to escalate. And again, I know it's not specific, but I'd like to talk about this with someone outside this meeting, if at all possible, because it's urgent that we do need to try and resolve some of these issues that are out there at the moment. Across the whole county, this relates to North, but I could still, it would make a difference to other schools elsewhere in the county as well. Thank you.
Thank you. I think you had an offer of that meeting, and I would guess probably as part of that you'll get an offer of what you can do in that specific school. And bearing in mind it is one, you may be able to bring it back once you've found that provision, which may be replicable to other schools. Becky, I know you've been waiting. Just let me bring you in, please.
Yes, thank you. It was just in relation to the point about maintained schools and academies and the different support available. As Nicola said, the mental health support teams do go across a range of schools, but they're not available to every single school in Staffordshire. So it was just to say the mental health leads network that I talked about earlier on is open to and offers support to maintained schools and academies. And we also work with schools who have access to mental health support teams, but also those schools who don't have access to mental health support teams. And really one of the core kind of principles of that group is how do we share good practice, ideas, resources, support across the system. So if there's really good stuff going on in a particular school or a particular area, how do we share that and replicate that so we've got a consistent standard across the whole of the county? So it's just on that point, Chair.
Thank you, that's useful. Becky, I'm not sure I heard the answer to this, but of the schools that the county still control, small number that it is, are they all engaged in this programme?
So that's the survey that we did. I don't have the results for me here today broken down by maintained and academy school, but the survey that we did was across every school in Staffordshire, asking them the question about how far they're engaged in the whole school approach. I think it would be fair to say we had mixed responses. Some are absolutely engaged, others less so. And I think that's the work that we need to be focused on over the coming months, is working with these schools where it perhaps isn't as embedded or hasn't been considered as in detail as we'd like it to be. So it's a journey, but we've not reached the destination yet, I think is how I put it earlier.
Yeah, thank you for that. Because I just note that there's 116 schools on this list, and I think Councillor Edgula referred to 400 plus earlier in the day. So there's a big gambit, and it does strike me that the ones who are maybe a willing ear, because they're mayor council related, might be the ones to start with, because if we can't do it in our own house, then where can we do it? Let me bring in Councillor Edgula.
Thank you very much. Thank you, Chairman. Well, one of the questions actually is on page 58, at number 18, the feedback from children and young people highlight the lack of support outside working hours. And I'm wondering what we can do to eliminate that problem. My second question really is on page 60. And again, I come back to what Councillor Flunder was saying about schools and about some of the head teachers and that probably not wanting to engage. Can I put my mental health champion hat on actually and say, is it possible? Well, and talking to Councillor Flunder and some of the school that you're talking about, the academy that you're talking about, that I could go along and talk to some of these head teachers. And thank you, Paul, for the work that you've done. But I'm really, really passionate about getting these help for these children at a very young age. And you know, if they don't get that help, then we could have lost them for the rest of their life and what have you. Now I'm living proof of that's done that journey with a child that at the end of it, because he didn't get that help at that early age, and I'm talking about 3, 4, 5, 6-year-old and 7, you know, that early intervention, because he didn't get it, at the end, it cost him his life. And this is why, I'm sorry to say this in this chamber, but this is why we've got to understand that, and I don't think some of these head teachers probably understand the problem that there is out there and what effect it can have on children's lives. But please, if I can help in any way with my story, then I'd more than happy to do that. Thank you.
Becky, is that two for you, please?
Yeah, absolutely. I think absolutely getting into those schools and having conversations is really important. And I think mental health support teams is part of that. We have also got other staff and colleagues on the ground. So I know schools that have been perhaps less engaged, so they've had an offer of a mental health support team, but they haven't taken that offer up in the way that we would like them to. We have got other colleagues on the ground. So I know recently with North Staff's combined healthcare in the north of the county, they are reviewing again their lists of which schools are really actively engaging in the offer and which schools are less so. We have colleagues in the district, you may have come across them in this committee before, the effective practice development officers, who are really kind of our partnership experts on the ground. They're our early help champions. They have great relationships with all kinds of partners, and very often they're able to perhaps go and have some of those off the record conversations with schools and find out what are the barriers and challenges that schools are facing that are perhaps preventing them from seizing hold of those offers in the way that we'd like them to. I guess the other thing that we're doing and we're looking at really honestly is where schools aren't engaging, is being really clear with schools what our expectations are of them. And if they're not able to engage, actually withdrawing the offer of mental health support team support, but reallocating it for those schools where they're crying out for that offer. Obviously, that's not leaving the schools with nothing. They've still got Action for Children. They've still got access to other support, but it's been really clear about actually signing up to mental health support teams. It's a really amazing support for a school, but schools do need to be proactively engaged in that and really seizing hold of that opportunity. So I think Councillor Edgeler, the idea of having a conversation with schools about personal experience and about how much difference it makes in lives, I think is really important. So yeah, potentially we could maybe use the mental health leads in network, education network. You know, we could perhaps invite you along if you'd be comfortable to speak to that network and share your experiences, and also hear directly from the schools about their views on engagement. You're very welcome to put that offer forward if you'd be interested in taking that up. I'll pass over to Saab now from MPFT.
Thanks, Becky. I just wanted to add to what you just said about the support that we get. So we're very engaged with the Department for Education as well in terms of ensuring that schools are engaging with the offer of support. So we have meetings with schools, governance meetings, and we regularly discuss with the Department for Education, because I feel that us trying to sometimes talk about our service and talk about how effective it is doesn't always get heard. So I think Steph from the Department for Education is a useful tool to sort of persuade schools to engage. And I also wanted to pick up on your first point about what do we do for schools outside of that 9 till 5 working and having accessibility. So we have launched in the South a digital online support offer that works with emotional health and wellbeing. So it's called Cerebral, and they've got a sandbox website that does lots of layers of support for children and young people outside of sort of 9 till 5 working. So you can have a chat function where you can speak to somebody just about a concern that you might have there in the moment. You can also access support and intervention on a self-help basis, but then they also support one-to-one support from a low intensity mental health basis as well.
Thank you very much, and thank you for that. Yes, as I said, the offer's there. Please get in touch with me because I really want to help with this. But I think there's a bigger picture here, because if there's nothing that tells the schools they've got to do it, then I think there's some way that we should be speaking to our MPs and that to make sure that they do it. Thank you.
Thank you, Anne. Fantastic ambassador. So I'm sure that everyone on this on the virtual screens will be ripping Anne's arms off. Maybe you might want to start at the top with the Head Teachers Forum, because I'm always minded that it's 400 schools. That's 400 visits. That's potentially a year to get across the ground. There's the Head Teachers Forum. I think anyone who sees Anne will see her passion for this and the importance of doing it. The stats that Steve Norman referred to earlier, I think, are irrefutable. I've got one last question, which relates to the PRU. I noticed that the Burton People Referral Unit is engaged in this programme, and I think that's really wise, because, and I'm not talking about Burton specifically, but I'm talking about the PRUs across the whole of the county. It would strike me that some of those with the most challenging behaviours are in the PRUs, and actually I'm surprised that all the PRUs aren't fully engaged with all the support and help that they could be getting. Do you have a reason why the rest of the PRUs across the county aren't engaged?
So it's in terms of selecting the educational establishments, it's very much a sort of partnership approach that we take to it in terms of deciding, because obviously they need to be in the right place to be able to engage with this programme as well. And as you've heard, there's been a few occasions where that hasn't, and despite best efforts of everybody, we haven't been able to change that around. So I think there is a, correct me if I'm wrong, Deb, I think there is a PRU in the Stoke patch, which obviously will pick up some children and young people, obviously outside of that local authority as well. but it's very much a partnership approach to those educational establishments. So again, is our ambition to sort of scale up, then we're hoping to kind of include those as we move forward. Do you want to add to that, Deb?
There's also, just as you're saying, with the PRUs, they are sort of those young people with sort of quite high need mental health and emotional well-being issues. So with it, when you look at the skill base of an EMHP, it is that very low level early intervention. So sometimes those needs aren't best met. Those young people's needs aren't best met by EMHPs. But what we have found, and I think teams from the north and the south are engaging in the senior EMHP role, which the training has started in January, which is a 2-year course which upskills those EMHPs, which is a new clinical role, which gives them additional high-level skills to support those young people, especially those accessing the PRUs that would have maybe more difficulties and with sort of neurodevelopmental issues as well that maybe are more pronounced. So that's increasing their skill base, which means our reach and our effectiveness will go even further with those young people.
Thank you.
Really
was anything? Sorry.
Sorry, Nicola, anything further, or are we?
I just wanted to ask if Saab wanted to add anything around the Burton PRU in particular.
Yeah, we've based some really good relationships in the Burton in the East Staffs Pro, and I think, like Deb just said, we probably don't do lots of one-to-one intervention within the Pro, but what we do is work with the staff and upskill the staff in terms of their knowledge and their understanding of emotional health and well-being, and work through that member of staff that has already created those really firm emotional links with that child or that young person. So we have got some really good whole school approach work happening within the Pro, but like Deb said, we probably don't do a lot of one-to-one intervention because they probably fit, the young people's presentations probably fit better with our core CAMS services.
Really useful, and thank you. Logical, honest and sensible answers, so thank you. Okay, I think, and we're getting no further indications from this side, we should first of all thank the Cabinet Support Member for the work that he's done very consistently over many years, 3, 4, 5 years in this area, and for bringing the report to committee today. Equally, thank you to those people who've been with us both in the chamber as well as virtually, and so Nicola, thank you, and your team, Deb, Lise and Saab, for all of your input. Really appreciate that, and equally to you, Becky, for your input. Difficult subjects, I'm sure we'll come back to them, but otherwise I think that concludes this morning's meeting of the Health and Care Overview and Scrutiny Committee. Thank you, everyone.
Thank you, Chair.